Have a little looky.
Jesus. You do realise they're under your care until you hand it off to the doctor? Or was it handed off, or was it in the care of the EMS?
Yep.
Okay, you're fine then. Chain of custody.
Yep.
So how are you doing, Jeb?
Alrighty. Let's have a look at the status right now. See how they're doing.
Letting them down in the water.
Yep. Okay.
Well, I didn't hear that, but they did. No, that was not unaffiliated.
Oh my god, Cypress set other people in the water?
Yeah. I don't think this was a planned water escape. They crashed their car beside the water. It was just a
Yeah,
convenient
doctor's
escape.
here. Let me do turnover. Hey, Perry. I arrived on scene. She was wrapped in a thermal blanket, low pulse. I put her on oxygen. I tried suctioning as best I could. She did have a pulse, so my best option was to put her on the Lucas machine to continue to circulate. Because, yeah. And yeah, thank you.
No, that's all good. You're good. Thank you so much, okay?
You're welcome.
Breaths, deep breaths.
Yeah, I'm trying.
Okay. Let's have a look over for any injuries that need to be worried about on the outside here.
Oh, okay.
That's my theory. That's why I've not got ill while all the others around me did.
Guys, sidewalk. Yeah, we got an exorcism going on.
Okay, let's see here. Okay.
Let's get you in this bed here.
If they're not critical, could you take them through to Dr. Skip for me, please?
Of course, no problem.
Double punch.
Right, let's get you to Dr. Skip.
Oh no, wait, I think there's a doctor there actually. I think there's a doctor there free.
What are we gonna do about that other guy?
Okay, I might have to take them for a scan because this bruising is not looking good.
On a scale of 1 to 10, 10 being the most, how much pain are you
Okay.
feeling?
Let's try and ease him over onto the bed for me, and then we can try and get him back for a scan.
Won't be too strong, but
Okay, let's take him back for a scan. We actually just clean up most of this water as well, just in case. Because I'm a little worried.
I'm gonna slowly ease you up in bed. 3, 2, 1. Just want to take it a little easy and make sure you don't pull that stitching, okay? Just make sure you clean it.
Let's get him a bit comfortable, and then we'll take him back.
Perfect. Thank you so much, though. You mind coming over here in 1 minute, mate?
Yeah, there's some guy that's thinking about something. We gotta just like get.
Hello.
Guess what? I found more shrapnel in my body.
Oh my goodness.
She's okay.
No, I need to take. I need to take her back
What
for
are
a
you?
scan.
What are you sleeping on?
Alright.
Back here as well for you guys. Oh god, the door. Ugh. I can't. Okay. Oh
Shit.
Oh, sorry. I locked it up.
Okay.
Alright.
Oh.
So come. I'll say if you could come in here
So
once.
clunky.
Then you put
You
your
got it,
cuff up.
Jack. I'll
What?
lock this door. Yeah, you cuff it
Okay.
or whatever the doctor says.
Alright. Let's just loosen the cuffs for me and remove them just so that I can get him comfy on the bed.
Yeah.
Alrighty. Thank you. Oh, not you. Alrighty. On the bed we go. Dr. Skip, if you want to put them on the bed, for some reason I'm not able to put them on the bed. There we go. Thank you, Dr. Skip. Make sure all the metal is off of them. even though we're just doing an X-ray, just to be safe. Alright. Excuse me while you're in front of my controls. Thank you. My controls. Don't touch any of the buttons. You touch any of the buttons, I will get you trespassed from this hospital. No. No. That's against Pippa. You know you were talking to the SAMA director and the head of one of the heads of this hospital. You literally just told me you want to take a picture.
Anyone?
Okay. I'm gonna do an X-ray in 3, 2, 1. Okay. Alright. It just looks like it's a little fracture, but not too serious. Okay. Alright. I'm gonna take you back to the ICU ward just to rest for a second, just so we can get you awake and everything. Alrighty. Let's get you off the bed here. Upsy daisies. Of course it's this gremlin. Alright.
Oh, here, we're ready.
Alright. I'm just gonna test a curd and for her to heat up a little bit if you guys want to come in. Oh, god damn it, I can't. I hate these doors. Okay. Let's go this way.
Oh god, ow.
And then
Oh god.
we're gonna clean it up and put a
Alrighty.
nice little band-aid over it. Do you want
In this room here. Oh, maybe not in this room. Maybe not in this room. Let's go into room 5. Nice peaceful room, away from everyone. Alright, just check how her temperature is doing. Okay. Temperature's going up a bit. Let me see if they are conscious at all. Let me have a look. I'm just going to shine this little light in their eyes here.
Ow.
They are conscious. There we go. Hi!
Ow. I'm also blind now.
Zola, question. Did you 3-on-1 saying that we're off duty at all?
No, I'm sorry, I completely forgot.
No, you're all good. That means I don't have to 3-on-1 say I'm on duty.
Oh, okay.
I'll still say I'm on duty, but I just want to double check.
Okay, thank you.
Hi there, you need some help?
Yeah,
What's
took a
happened?
pretty bad fall.
Oh, let's have a look.
My leg feels weird. My arm.
Oh,
it's not feeling so great.
did you like twist your ankle?
Yeah, I was coming down some stairs and it's fucking pissing outside, so
It's
I
soaking
went down the
wet.
stairs.
Yeah. Okay. It does look a little swollen, along with your wrist as well.
Yeah, I figured that much.
So we're just gonna clean this up here, okay?
Thank
What I'm gonna recommend, because it is a swelling, I'm gonna apply some anti-swelling cream on there, which anti-inflammatory. That's what I was looking for. I'm gonna apply some of that on there, which hopefully help it go down. My recommendation for you is, even though it sounds stupid, walk it off. All right.
All right.
When it comes to this
No
stuff,
ice.
it's better to walk on it.
All right.
But if it gets
You're
worse,
the doctor.
come back. Okay.
Thank you, ma'am.
You're absolutely welcome. Let me just make sure I get every little bit here. Because we don't want you leaving and you still being hurt. Here we go.
And then I'll be right back.
And there you go. You are all good to go.
Thank you so much, Doc.
You're absolutely welcome. Alrighty. Do you need some help? Do you need some help as well? If you're speaking, I cannot hear you.
Sorry about that.
There we go.
Yeah,
Hello.
I slept very, very wrong. I think a spring poked through the mattress.
I have been there. I know that feeling. Let's have a looky.
Yeah, I definitely need to get it replaced.
Oh,
Yeah.
no, but it luckily it didn't go too deep, but I will clean it out a little bit for you. Just to make sure here. Yeah, it looks like it caught you like right on the side of your chest there, going in, and it kind of like hit your arm too. So it's not too bad. But that should... Oh, no. Just double checking. She might be bleeding, but I don't see. Okay. This last couple bits should help you.
Alright.
Okay, maybe one more bit. It was a little bit more than I thought.
Oh.
Okay. Alright. Let me just double check. I swear to God. I swear to God. Okay. You're good.
Alright.
You're good to
I'm
fight.
gonna have to track down the people from Furniture Hub and get me a better bed, because mine isn't cutting it anymore.
That might be the best thing to do. Any problems, you come on back, okay?
Will do, thank you.
You're absolutely welcome.
I think I need some help, Doctor.
What's
My
wrong?
chest is feeling all tight.
What do you
I'm
mean?
taking a short, shallow breath.
Hi. What's up?
I have owies.
You have owies?
Oh.
Everyone was looking for you, by the way. People were looking for you. Did you know that?
How are you doing?
I'm doing good. You didn't answer me.
How are you doing?
I said I'm doing good. Yeah.
Oh, there you.
Can you hear me now?
Yeah.
I said I was doing good. I was supposed to say
Oh, okay.
people were looking for you earlier.
Why?
As in the PD and that, because apparently you were meant to be at a court case, but you weren't there. And then Doc asked me, and then I said I haven't seen you. So they were a little worried about you.
I'm sorry, give me 1 second.
You're all good. You're all good.
Alrighty, Pixie, you have a good
Alright,
one.
I'll catch you later.
Sorry about that.
Oh, you're all good. Are you okay?
Yeah, no. Yeah, I'm okay.
Was it because
What happened?
So everyone was worried because I got a call from Doc asking about if I had seen you or anything, because apparently you were meant to be at a court case or something, or said you were going to be around for it, and none of the judges or that knew where you were, and everyone was a little bit worried about you. That was all.
Oh, okay, yeah, no. This week I don't have any set in stone plans.
Okay.
We'll see, but I'll go over and check in just to make sure.
Yeah, I was like, go check in, because they were like, I don't think Doc's around anymore, but I'll let him know that I did see you and you were perfectly fine. Okay. Because they were a little bit worried.
Okay. All right. Well, thank you.
You're all good. All right.
All right. Yeah.
Take it easy.
All right. Bye.
I swear to God, you better take it easy.
I know. I am.
I'll fight you. I'll fight you.
Okay.
I swear.
Well, I can't fight you right now, so that's not fair.
I know.
Let me go check in with them and see what's
Yeah.
going on.
Please do. Please be
Thank
safe
you.
in the rain.
I will. It's not raining for me. It's beautiful, bright sunshine.
Oh, aren't you lucky?
But not if everyone else is seeing rain. Probably not. But I'll go check in, and then I'll maybe take a little nap.
All right.
Again.
Go rest up.
Alrighty.
All right.
Bye.
Love you.
Love you all.
I love Ava. Ava's a good one. I'm glad that because she worked at the hospital for so long. I'm glad that she became a judge because she has that ability of being neutral and not being having that bias or anything, because she will see it from both sides and be able to rule accordingly when it comes to it all, which is what I love about Ava. So yeah.
The hell is that about?
Let's move this one first. If you can move them to the OR, I want to get them first.
Yep.
The other two, could we get them stabilized by Dr. Skip and in the ICU ward for the time being?
Okay.
All right, let's go.
I can help with that.
All right, Mello.
And then I'm trying to get more doctors on the way.
We're gonna take care of you, Mello.
I'm typing at the same time as it's all this right now. Okay. Okay.
All right, I'm gonna get you into the bed. I'm gonna get everything hooked up for you. All right, blood, oxygen. Okay, right. Hooked up to the machine. All right. Okay. Alrighty, hooked up to the vital signs machine. Let me check the pulse again. Okay, still weak. Machine's gonna monitor just in case you need a zap. Hopefully you don't need a zap.
Okay. Okay, I put out the thing. If you can check on for me, if you can go check on the other two.
Yep, we'll do.
That'd be good.
Yep. Yeah, he's
Could you
still
also make
bleeding
sure
through.
Could you make
Yeah,
sure those
sure.
guys step outside, please? Because otherwise I'm not
Sorry,
going
I
to concentrate.
I can't hear you.
I said, could you make sure? Could you take Peach and that away from here, please? Because otherwise I won't be able to concentrate.
Hey, Peach. Hey, we're gonna have you wait outside, out in the waiting room out here, okay?
Oh, okay.
Yeah.
Okay, let's start cleaning this up here. Alright, let's hook up some more blood bags. Let's do double blood bags so I can focus on these wounds, see what we're going. Let's do an x-ray as well. I want to see if any vital areas have been hit. And let's also get a suction tube down to make sure that the airways are not blocked. Oh! And then it was punctured lung. Okay, let's have a look at that. Oh dear god. Okay. Yeah, double bag it for me, Dr. Skip, because I just saw that area right there, that looks like the main artery, and we need to get that first. We'll do the artery first, then move on to the lung, and then we'll fix the other areas as well. So let's do this here. What I'm gonna do, I'm not gonna do too invasive. We're gonna go in through the holes, of which we have right now. Go in through the holes, and then we can get a better angle at it that way, because I don't want to fully open them up just in case. So let's go in through this hole here. Just want to check, make sure there's no bullet remaining. Oh, wait. Oh, that's the back. Oh, that's the table. Oh, that makes sense. That one's a through and through. Anyway, so that means there's gonna be no bullet. Let's see. Let me try and see if I can find the artery here. Let's see. Come on. Suction, please, nurses. Okay. Give me the clamps. If you can grab me the clamps there, thank you. Let's try and clamp these down so I can repair it. This is being a little slippy. God damn. I guess that's because it's the main artery. Jesus. Fuck. Okay. Keep holding suction. I might have to try and... Let's try and get this in here again. Come on. Okay. Those ones. Nope, it's just slipped off again. Okay, give me the other clamps if we can. If not, I'm gonna have to try. I'm gonna have to try something else, which I don't want to do. Yep, those ones. The ones that got more grip on them. Yep. Thank you. Okay, the files are dropping. Shit. It's going lower. Okay. Can you get me some more... get the adrenaline and stuff ready just in case, because I'm scared that those vials and the blood pressure is going down. Get some more blood on backup just in case as well. Alright, we're going to try and clamp this one more time. Okay. Here we go. Shh, it just slipped again. It just slipped again. This is not good. Okay, piss.
And you're in surgery. Where are the other patients?
They should be either in the ER or the ICU ward. Try the ICU ward, because I did ask them to move them there for the time being. Okay. Come on. Shit, that's not looking good. That is not looking good. Alright. I'm gonna have to open up. I'm gonna have to open up this wound a little bit more. Shit. Actually, that might... Don't push adrenaline yet, because pushing adrenaline will make the heart go faster along with the blood. I'm gonna let it lower, which is, it's not the best, but it should hopefully stop this bleeding a little bit and may make it easier for me to clamp further up on the artery. So since it's dropped a bit there. Okay, let's try now. Suction, hold it, and let me clamp. Come on. Yes, it works. Okay. Right. Give me these sutures and the faux skin. We're going to stitch it up and then apply the faux vein skin around it to try and hold it in place so it does not tear or open at all. So let's suture these up here. Okay, here we go. Okay, alright, and the faux skin for me? Thank you. Okay. Let's wrap that up here as well. Alrighty. That looks much better. Okay, I'm gonna remove the clamps slowly. Hopefully that works. Here we go. Slowly but surely removing them so the blood flow can go back to it. Let's see how that does. Is it gonna hold? Okay, I think it's holding. That's good. Okay. Now that that bit is done. Okay, the heart rate's going up. If we can hook up some more the machine and everything just in case they do flatline. I am very worried because I'm about to go in and at an angle here to repair the lung damage. I just want to see how badly it's punctured. If it's a through and through or not, let's do another scan just to see where this, because I saw it hit the lung. I just want to make sure if it's a through and through or if it's pushed the way in. That is not a through and through. Okay. No, I see that dark solid object, and that is a bullet right there. Okay, we're gonna have to try and extract the bullet through the way it came in. So notice if we can hold suction for me. We are going to try and remove this carefully. Are we all ready? Okay, nurses hold suction. Let's go in here. Come on. That's a little slippy bugger. Come on. Got it. Okay. Thank you for the tray there. Alright. Let's get some more of the faux skin. We're going to try and suture this up. If we can put a tube going down to suction out any blood remaining within the lungs, get that all out for the person, for them, so then it shouldn't be all good. Okay, let's apply the faux skin here. Alrighty, I think that's looking good. Alright. Let's suture all this up. Keep him on one blood bag. Check it every now and then. Check the blood pressure. But then most likely we're gonna watch him overnight in the ICU ward. Let's just ease him out the bed here quickly, and then this get him all cleaned up, and then so we can move them to the ICU. Okay, suture this here. This is the awkward moment that I can't get him off the bed. Skip, do you want to quickly ease them out the bed for me? Because I'm unable to grab them. There we go. Let's clean them up, make sure they're all good before I move them. Because I don't want to move them if they're not fully cleaned up. Because I want to make sure they're presentable in the ICU at least. Skip, do we have an ID at all? Their name at all? Because I think I heard it, but I just want to make sure. For sure. Okay. Alrighty. Let's move them to the ICU ward. I need to work out what room is not being used right now. I think room 2. Unless somebody's in there, then fuck.
Snoopy wasn't looking good. Opal wasn't looking good.
Opal's in surgery.
Not yet.
Okay, surgical suite is free.
I think that the fragment is lodged. It might be hooked onto something here. We're gonna attempt to kind of pull it up.
Okay, let me just check for some ID.
With my drill a little bit, see if I can vibrate it loose.
Romello Porter.
Trim some in here, just maybe get a rough little edge so I can get a good grip on it. These last 2 bullets are really deep in there. One final attempt at this one, and then we're gonna see.
I'm just gonna quickly check them in, and then I'll grab the
check for
emergency
the
contact
vein.
list and everything.
Watch this wound up one more time.
It was 4694, right? Yep, okay. Just making sure. 694.
The ultrasound is going to show me if there's any
Alrighty.
ruptured veins.
Let
or
me check for an
arteries
emergency
that I need to
contact
patch
list
up.
at all. It's just all of BCSO. Wow. All of BCSO. Okay. Just BCSO, not LSPD?
Alright, so
I wish they had documents on their phone.
alright, here's what we're gonna do.
Okay, let's see here.
Alright, we're gonna attempt to put a small graft in there to essentially bridge the blood flow connection. And they should stop the blood flow itself. The oxygen levels, I feel, Dr. Skip, are related to
I don't know.
BFV, so we gotta take them one step at a
Okay.
time. Let's go ahead and see if we have the grafts in. Okay. Trim off the edges.
Okay.
Let's go
I'm gonna
ahead.
try and list them of the PD know so they can help me inform them.
Give it a push.
But give me a couple seconds because I need to go check on the other patients. And check on the other doctors for a second.
Give that a push in there. See if we can get the blood flow restored.
Have you just been doing him at all?
Yeah, he was the only one of you that I saw.
Okay.
Yeah, well, he was the first. Alright. Blood flow seems to be restoring.
What the fuck is Opal?
Little listen in there. Okay. I think Dr. Skip. Jesus. Give me 1 second, Dr. Skip, since we've got him somewhat stable. Hello.
One second.
Jesus Christ, do I fall in it? Alright, Dr. Skip. When it comes to BFV, the veins coming towards the side of his chest, is this a new symptom that I'm seeing, or is this just the standard progression of it? You know that when a body is in extreme shock and distress, the fever can become a little bit more rampant.
I'm gonna look for Opal because could have sworn Opal wasn't meant to be in there. Oh, hello.
Hi.
Venus? Question: Did Opal already leave?
I think Opal already left, man.
Okay. I just want to make sure because I know she was critical. That's why I was worried about her just then. All right.
Okay.
Thank you for letting me know.
Yeah, no problem.
Sutures. Thread it through and seal them all up. Wipe it all down.
Yeah, your one's just the last one. Alrighty. I said I was gonna contact me. I'm gonna wait until Snoopy is going in the other room, Dr. Skip, just to contact, so people don't stare at Snoopy while he's getting treated right now.
The old visions to be expected with the BFE. Essentially, Dr. Skip, what's happening is it seems like the virus takes the oxygen that he's breathing in, uses it for itself, and then the patient gets the leftovers. It's like not a non-symbiotic relationship. So I'll notate it on their chart. Look up here.
Okay. Let's get him comfy on the bed again.
Are we gonna be waking the patient up, Dr. Skip, with a little bit of adrenaline and some drugs to the IV, or do we want to
let me give
here in the ICU for long-term rest?
Let me get that feeding tube attached here. There we go. There we go. This should hopefully help their nutrition as well. Alrighty. Let me go see how they're doing next door and see if we can open up visitation at all.
Dr. Skip, did you get that last one? I might have missed it myself. Are they gonna be waking the patient up? Alright, so I will check in into Jerry then. We'll just make sure he's got a banana bag here with some food and drink. Put this in the banana bag since it's a little greasy. It should be ingested sooner than later. And he'll be good to go. We'll put him in recovery. Do we want visitations, Dr. Skip? He's stable. Peri.
Yeah.
4 to the 5 bullets were extracted. One is just in a spot I couldn't. Go ahead.
Headaches or you?
Anybody else on the list?
Is everyone having headaches?
Not that I know of.
Okay.
It's fine. I need to contact BCSO.
You're all good.
Let me call the one person I know, and then they can do it if they're around.
I have somebody's.
I have
from
one of the
BCSO.
sergeants, so. Alrighty. Ventura is going to be free on morning to see if anyone does come and see if anyone is going to come visit and stuff. Hopefully. But we'll slowly but surely be filtering them through. If that is all good for you, Dr. Skip. Yeah, that's what I thought. We'll keep an eye on him and everything. We'll just wait to see if anyone do come and visit. But I'll make sure to note that he's not fully out of the woods until we get past that 24-hour mark and everything. Alright? I'm just going to be outside the doors if you need anything. Alright, thank you so much.
Would have come and helped earlier, but there was like a line for the train in, so.
Really?
It was. There was like a 10-person line for the train.
Jesus, never at the train station. That's new.
Yeah. Do you want me to stick back here with you guys, or just treat people in the ER?
You can go shoot people in the ER. It should be good.
Okay.
Yes,
I'll
Stacey's
be
got
on
that
radio.
one. Yep. Thank you, my love.
If you need anything.
If you need anything, let me know too. Okay. Hi there. Sorry, I'm just finishing this one nugget and then I'm good. And I think I'm gonna quickly run to the loo and then hopefully we can do the interview and stuff in a minute. Well, how's everyone in chat? No, I'm just snacking, so. Okay. Yes.
I'm going to run over to the City Hall sec. Need to check something.
Wait, what are you checking?
Well, I need to vote. That's the one I need to do over there. Make sure I can.
Fair. What's the second thing?
I need
It's because
to...
I'm still eating.
There's been a voice in my head that tells me to check something. Well, it's not a voice in my head, so.
Huh?
Just noticed, you know, no one's calling to these the interest form. No, there's no what's it called? Checks done on the person we're meant to be interviewing.
Oh, let me come with you on that one actually. Let's go. Now you said that. This door! I fucking hate this door! Wah! I'm fine.
You okay there?
Yep, I'm good.
I'll let you do the checking.
And robbery is a felony, isn't it? Oh, for fuck's sake. They have a felony. I'm gonna call an officer to see how long she's had it.
Hi, Peri.
Hi, favor. So,
favor?
I say favor as an officer.
Ask me.
We're about to do. I say we're about to do. There's an interview that was scheduled for today from a person. I've just seen they have a felony. I want to find out whenabouts they got this felony.
Ooh, let me have a look. Who would be?
It is Mayra Burke. Maera.
Okay, I see it, and it's robbery. So it might be a 24/7. Let me figure it out. "24/7 robbery, in December. Start of December.
In December.
Yes, they pled not guilty. Let me just see. This person can very simply just get an expungement. It is clearly them at the robbery. I would just advise them to go speak to a judge before they come to the interview.
Yeah.
Easy expungement.
That's the thing. The thing is, like, if that's been there since December, this tells me that my doctors, who are meant to check before they get interviewed, didn't check.
How do they usually check?
Stacey. We normally go to City Hall to check to see if anyone's got a felony. That's what we always do. Or that, if it's me, I ask one of you guys so that I can work out when it was.
Okay, yeah. Yeah, it's from December, 5th of December last year. But yeah, honestly, they probably don't commit crime and don't realize like they either have a felony for one or realize that they can get an expungement like that.
Yeah, that's what we're waiting, because I'm literally waiting on them right now. They're I'm not going to explode, I swear.
I'm gonna check my vehicle.
Alright.
Heads up, Judge Danielson is in the lemon list if they do want to get an expungement.
Fair, thank you. Oh, Remy. Okay. Let's hook up some more blood bags if we can. Let's have a look at that leg. Because I heard it was I believe it's the femoral artery may have been nicked. So let's have a look.
I guess they listened to me when I said no on the way in.
Okay,
They're
good.
gone. Yep.
Thank you, my lovely.
You're welcome.
It was either that or next it was going to be the bleed stop, the IV form.
Okay, let's have a look.
You done the best you could, honestly. If
Um,
you weren't there, she would.
Below the hip, about 30 centimeters long.
I can't have a third one. I can't have a third one this week.
Jesus Christ. Okay, let's get a closer look inside here. I want to make sure there's nothing, no severe residue or anything like that. If we can, please.
Fucking locals, they do my fucking.
Did that guy eject from his freaking car?
Oh, I wish he would have.
I wish you had, honestly. Right, I'm gonna move my ambos in the way.
3 lights and sirens, and we're
Straight
still gonna go
T-bone.
140
Straight
miles an
T-bone.
hour.
Yeah.
Idiot. Thank you.
will in a minute Violet throw up a report because that was a crit call, so.
Yup. I'll start it.
I think I see a shiny bit of... Is that glass? Okay.
No, I'll start it because I need to do it for my probationary thing.
Let's
don't I?
flush this out and then hold suction if we can.
I'll add my part when you're ready.
Let's hold suction. Okay. Shit, okay, it did hit the femoral artery. Alright, can I get some clamps, please, nurses? Just hold some clamps because we're going to have to repair the femoral artery here. Okay, thank you for the clamps. Alright, we're going to clamp here. In 3, 2, 1. Come on. See, has this clamped? Do you have any blood coming through? Continue to hold suction and flush it out. Okay, I think we're good.
Radio check.
Hello. Alright. Let's get some of the faux skin if we can to wrap it up if we can. So it's in place and it holds, I say faux skin, faux vein skin. So if it does reopen, it will hold it together so it's all nice and snug. Thank you, nurses. Let's apply it here. Here we go. Let's see if I can... There we go. Carefully does it.
Thanks, Rose. Alright, bye.
Okay. Looks good. Okay, let's remove the clamps slowly but surely. Here we go. It's a nice spike. Is it holding?
Go check who that is.
Thank you so much.
I put myself 10-7 a second, Violet, while I do this paperwork.
Okay. Looks good. It looks good. It looks like it's holding very well. Okay. Let's clean out if see if there's any more fragments of glass at all within their leg.
Did you say she ejected, Vi?
She ejected.
This wasn't an ejectocito?
Yeah.
She was on a cliff edge, Peri. That's why she's cut up bad.
Fucking hell.
I blame the local.
The locals up there were absolutely fucking... It was like they're all need rabies shots or something.
The locals were the ops in this.
Yeah.
Wait a minute. I hear you, but I don't see you. I see. Wait, where are you?
I'm just to the side of the door.
Oh, there
here.
you are. I was like, it sounded like you were like I thought you were like standing by Violet or something. That's how close it sounded.
No. Sorry. Anyway, I'm gonna let you concentrate.
No, she's all good. She's all
Relax.
good. I just need to stitch it up. Okay.
Oh,
she's fine.
Yeah, everything else was fine. There was no other injuries. Do you know what I mean? It was just the rocks cut her leg open bad.
Actually, it was glass.
Oh, it was the glass from the car. I thought it would have been the rocks, personally.
Yeah, her vitals are going back up. You guys don't have to worry. I will recommend that she does be passenger princess.
She was a passenger princess.
Who was driving?
I was. She didn't have her harness on.
Oh my god. Okay, you're going to need to get her a baby, like a baby seat, a toddler seat, and you got to make sure she clips in.
I heard someone had a bubble wrap soup. Someone was telling me maybe we could get that for her.
James Randall has one. James Randall has one, and I don't think James Randall will give it up lightly.
Oh, for God's sakes. Remy at this point needs it. She's so freaking accident prone. Perfect title. Remy can't fly.
SOP should state that Remy needs to be buckled in before any vehicle moves.
I have to feed her too, because she'll forget.
That too. She gets so mad at us. She gets angry when we go to the shift 3 meet and then all of us EMS just start handing her food. But she's okay, so that's why we tease her. If we didn't tease Remy,
Alrighty, I think she is looking good. Dr. Skip, is she going to need to rest up in the ICU overnight? Or maybe over the weekend? Because I'm all for keeping her in the ICU over weekend. Everyone else had that explosion, right?
Yeah.
Okay.
No.
I'm going to go check the ambulances.
Oh my god.
Oh no.
Alrighty. Then let's take her to the ER to wake up then.
Oh, what's happened?
Even though I'm very tempted to put her in the ICU.
Did explosion happen?
What?
Yeah.
I didn't even hear it. Is it locked?
It's. I'll unlock it for you guys in a second. Alright, let's get it up and Adam. Alrighty. I'm going off duty after hearing that. Come on. Come on. Don't think about murder, please. Blake.
Hello.
Just a heads up, loads of bibs.
Hey.
And this one might need some,
Need what?
we just found out something. And I feel like she
Okay.
might go on a killing spree soon.
Oh god. Ember is on a over there just hanging out for a bit.
That's all good.
Yeah.
I'm probably gonna, fuck, I need to do a surgery, but I don't know if they've disappeared or not. Fuck.
Oh god. It just feels like there's tons of stuff that I missed out today.
Nah, you're fine.
Yeah.
Was it besties?
Come
Bro, I
on.
said we do a drive-by on them, bro. You wanna do a drive-by?
there's a doctor.
Oh, there is my fault. I'm so sorry.
I'm standing right here.
Yeah, I was on autopilot. That's my fault, too.
Lawyer at that.
I'm gonna kill him.
Don't.
Harry, he nearly got Tempest killed. I won't be happy until that man is dead.
don't do something like that.
Hell
Alright,
yeah!
So what I'm gonna do a blood test on you, just to see, if you do have what we call is a black vein fever, coughing up blood and stuff. What we can give you, for the time being, if you do have it, is some cough drops, which will help soothe your throat. Coughing up the blood is because it's your like lungs and like your throat, your larynx is getting irritated. What we can do though, let me just do a quick blood test on you, and
sure.
then see. Okay, so if you just want to raise your arm for me.
Do you want me to go get the cough drops for him?
I'll see. Wait a second for it, just in case.
Okay.
Du, 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 du. Okay, I need to. One second. Yeah, the thing is, she's the intern.
How much pain you're in right now?
Alright, same as the rest. She's been.
She should be good.
Swiss cheese.
So bad, Dr. Skip, I didn't see that.
What?
Alright,
Okay,
okay.
breathing slow. Let's get a face mask on.
We'll be sure
Whereabouts is the pain coming from?
Okay,
Where I got shot.
through the vest. Let's remove this vest here, just so we can clear and see how far through these are, and if there's any exit wounds to these injuries.
Looking by Doctor.
That look like a ball sack now.
Bullets in the head.
Oh goodness, no. She need not kind of
Oh,
rock the
okay,
bottom
okay,
for a long
now-
time. You can do it too.
I do see some exit wounds here, but this
I want you to
third
do
one
for
does
me,
not have an
I want
exit
you
wound.
Control your breathing the best you can.
Too bad. There's a couple of
Keep talking to
AK
me.
bullets that caused
I
some
know
pretty
that you're
bad
with
bleeding
me
in both
at
your
all
arms.
times.
Still have a couple fragments in you, so we'll go ahead and get those out. See how you feel.
Let's do an ultrasound. I just want to see if any of the internal organs have been hit at all, or if I have to
Clean up
rush
this
them back
bullet
into
wound
surgery.
here. Looks to be a through and through.
Yeah.
Perfect.
Man, it's been rough for you guys with all these big.
Skip, can you tell me
weapons, huh?
his pulse level and his vitals?
Oh my god.
Speaking of,
Sounds like a war zone.
yep, another day.
Are
at the
you still with
hospital.
me?
Yep.
Yeah, I said about right.
Okay, let's see.
Alright, looking what
If I don't
Skip
see
has
anything.
told me,
Okay, looking on the scan, I don't think I see any
you are
built
all
up.
patched
There we
up.
go. I can speak. Okay, let's try
looking
and remove
good. What
this
I'm gonna
bullet
do
Let's
here.
get you all cleaned
I'm
up
gonna
here.
place my
One last
How many
hand on your
fragments I had
shoulder.
left in me? Oh my god.
and we're gonna
Well, you had
we're
4
gonna
and
get you
being that
back
they
on
were
your feet,
AK
okay?
bullets, they were just a little bit larger.
Oh my god.
I'm gonna place your hand on my shoulder just
one
now.
quick second before I help you with your
3
feet. You're still bleeding a little bit.
two,
I don't want you to bleed out. Okay.
and 1.
Try to get the tweezers here. Let's try and
How
get
you
this out
feeling?
I'm still bleeding.
carefully.
Mine's stable.
Okay, come on. Okay. I think I got it. Alright. Let's... Okay, let's flush there's a wound out here.
Skip has told me you're looking fine right now.
Oh, looks like you got me.
Get you patched up here.
Okay. Let's flush this out here.
How are you feeling?
Alright. I think that's looking
Okay,
good.
this last banded aid here.
I'm just trying to see if there's any fragments
patched up and
remaining
you
at
should
all
be
that I
all
need to
good.
worry about.
No problem, you're very welcome.
Then let me know. I'm gonna make sure to tell Dr. Perry. We're gonna not let Dr.
Alright.
Skip ever put
How are you feeling? You
the
feeling good?
shaver to your
Can you
head
walk?
again. That's not right.
He's not.
Yep, I can walk. Thank you.
No problem at all.
Thanks, Doc.
You're welcome.
Alright, arm
Hey,
over my shoulder and chin.
Maeve.
3, 2,
And could you back up for me a second while I'm
Try not to
trenching?
die. You just got back.
Try
It'd
to
be
stay
really
safe out there, okay?
terrible.
Thank you.
Stitches.
How'd that go for
Okay,
you,
I'm
lad?
gonna stitch these up here.
It went well.
Make sure these are all good.
I think that I
Big-
got
He's an interesting patient. Dr. Skip
Yeah.
and him are... He's also a certified doctor, unofficially.
okay.
He's like head of the HR here.
Alright. How's the vitals looking,
Very hard
Dr.
to say
Skip?
that. But, yeah, I wanted you to see that.
Oh my
You
god.
Again, don't bury your head in the patients. Be very, very wary and aware that Dr. Skip is talking to you.
Yeah.
Okay, that's not
Sometimes Dr.
looking
Skip
the
will talk to you
best.
if you look up real quick. He just sent a page.
Okay, it's not looking the best, but I think it's comfortable
Sometimes
enough
Dr.
for
Skip will
me.
listen to you that way as well.
Okay, Dr. Skip, do you
Okay.
think they need to rest in the ER for a little
Did you
bit,
see that
or
one? Yeah.
do you think
I
they'll be
did,
good,
yes.
or do you think they need to go to ICU?
Yeah, you see, Dr. Skip is just sending the pages. We get
Yeah.
them sometimes, but we ignore them if they're not for us.
Okay, I think they get to rest in the ER. No, ICU. Okay, okay, that's a good idea. All right, let's move on back to the ICU. Check them in and get them comfortable. Bloody intern should have got this patient. Right, let's get them up and comfortable. God damn it. Alright. Alright, I'm moving this one back to the ICU for a little bit.
Is that all of them?
That's all the criticals. There should be the non-criticals that are coming in. So
Alright, I'm gonna off clear the email then.
yeah,
Because we can handle the not
yeah, the not criticals, yeah, should be fine. Because the thing is, there might be some that might be critical that they just don't know yet.
Hello.
All right, but you should be good. It should be good. We should be able to handle at least all those.
Okay, thank you.
All right, tell me when they come in.
Absolutely.
At all, so I can get their state ID. 10955. Alrighty, I'm just gonna check them in for a little bit. Let's do room 1. Alrighty. Do we have any emergency contacts that I should contact while they're resting up in here? Okay, Korak and Austin Bean. Do I have their numbers?
Be honest with you.
Okay, let me have a look.
Don't know what's going on, to be honest. You know what I mean?
See. Okay, does look like you've got like a sore shoulder there. Doesn't feel like it's a break. It feels like it's more like a sprain.
Yeah, it's more like my rib cage, you know, my shoulder
Yeah.
blade, the rib cage, exactly.
So it feels like it's
exactly,
swollen.
you know what I mean?
So what I'm going to do, I'm going to apply some anti-inflammatory cream, which would hopefully help reduce that for you. Okay. Here we go. It's a little cold. I apologize.
That's all fine, you know what I mean? That's all fine. I appreciate that. Thank you. Thank you
mhm.
so much.
Okay.
Hey, you guys like doctors and stuff?
Nope, I just wear the stethoscope to look pretty. I'm just kidding. Yes, I'm a doctor.
Alright, if you
Oh.
just need one little bit more, and then you should be good to go.
You're the old knight from Princess Celebrities. I remember your name.
Whoa, what did you say?
You were a knight for Princess
Oh,
Helena,
that's right. I was a knight in the princess.
Sorry about
court,
my,
but then it was,
you know, this guy that dropped me off. I don't even know. He's a bit of a, you know what I mean? A bit of a
Yeah, I
psycho.
kicked out
Then
of the
so,
knighthood.
It's okay.
appreciate you. Thank you.
Yeah, you
Thank you,
take it
Doctor.
easy.
An evil knight, and I kidnapped.
Someone resigned. Okay. Over 10 years old? Oh my. Okay. That is good. Now I need to do the other external one. Need some out there?
Yeah, I do.
What's happened?
I think I got shot yesterday. Like, I feel like a bump somewhere, like I have a bullet.
Oh, let's have
and
a
then
look.
a local knocked me off my bike, so it's like my rib cage really hurts.
You do have a bit of swelling around your rib cage there. I do feel where the bump is too, so I'll quickly clean those out for you, okay?
Thank you.
Because luckily it doesn't look like it's fully healed over, so I can just pop it out.
Okay, awesome.
It's going to feel a little uncomfortable with me doing this, but just...
Okay, I'm ready.
Okay. And in 3, 2, 1. There we go.
Oh, yeah, that did
See,
feel weird.
Yeah, it feels weird, but then after a while it's like, actually it's kind of satisfying. Which sounds weird. But like,
it's it's a feeling of relief because
Yeah.
I don't have that weird sensation that I have something there, you know?
Yeah, that's basically what it is. It's like you feel like the irritation is like, okay, actually no. That's actually a bit of relief now. Because you don't have that pressure on there. But there you go. You should be good. Keep it clean. Rewrap it every day if you can. Any problems, you come on back, okay?
Should I use any sort of antibacterial ointment or
Yeah,
anything on it?
also use some like wipes or anything like that has antibacterial properties to it. Just be careful because it's gonna sting like a bitch, okay? Just take it easy. If it does start turning green or go pussy or anything, come back because it's probably an infection, okay?
Oh my god, I'd die if it starts.
Oh
No.
god.
Ugh.
You're all good, alright? Do you need some help too?
Thanks.
Yes, I'm similar, but I think my chest and each of my arms feel a little they got a little something going on.
They got a little something going on. Oh god. Oh god. I think you had it a little bit worse off.
Yeah.
Okay, this is gonna take me a little bit to clean, but you're also gonna feel like the pain of me like popping it.
Yeah.
But you're gonna feel the relief afterwards because the pressure's gonna be good. Okay.
On a totally unrelated note, shotguns hurt.
That they do. That they do. They're meant to do much damage to the chest and stuff. All right, ready for this to be popped out?
Yep.
Okay. Here we go.
Ow.
Oh, there we go. Alrighty, let's clean that up there.
Much better.
There we go.
Boy,
all right.
You're a lot more brave than I am. Holy shit.
All right, you guys take it easy, okay? Any problems, come on back, all right?
Thanks so much, Doc. We appreciate it.
You're absolutely welcome. Take it easy.
We'll try.
Let me go restock before anything happens. Emma said there's gonna be some fighting happening later. I swear to God, if I've chosen Thursdays as my day like to like work fully at the hospital and this is shit happens day, I am. I swear. I swear. Let's get 10 of those. Yeah. I want to change out of this outfit and go into my lab coat. Lab coat time! There we go. Okay. Untuck yourself from the covers for me, and then we can have a look over you.
見ときに足りないがね。
There we go.
There's a doctor in back.
Let's see here. Ooh. Okay, do have quite a few for and through, so we're just gonna clean these out for you, okay?
What was that? Sorry.
You do have quite a few foreign throughs, so you were shot a bit. So I'm gonna clean these
Yeah.
out. So these are gonna sting, okay? Okay. But here we go. Alright. Should be the first one. Okay. I'm gonna need a lot of supplies. Okay. How's that starting to feel?
It's a lot better.
Okay, that's good then. That's what we want.
EMS to doctor.
Send it.
In with a patient on a nasal ventilator right now. A gunshot wound to the back. Bleeding has slowed. Breathing is very, very low. Pulse is low. She didn't have a pulse at one point, and I now have a second individual that is also unconscious and not responding very well. I'm bringing them in now, and then I'm heading back to scene.
Okay, if you can take the one that's the most serious one to the OR for me. The other one, get them stabilized into the ICU ward, and I will deal with that one afterwards as well.
Firm.
Okay, just cleaning up these last little bits. And you should be good to go, okay?
Yeah.
I need... Alrighty, just one little bit more and then you should be good to go. Alrighty. Here we go. Let's get you up and at 'em, okay?
Yeah.
The person behind me, can you hear me properly?
Yeah.
Hey, you are good to go.
I can hear you.
Alright, what happened to you?
I got shot.
You got shot as well? Okay.
Yeah.
Let's have a looky. Let's get you all cleaned up and then get you on your way too. Luckily it's not as bad, but it will still need a little bit. Those stitches here.
Okay.
There we go. So we have 2. Okay, that should be the last little bits and you should be good to go. Just double checking. Alrighty, let's get you up and at 'em. Because You seem like you are all good to go, okay? Any problems as well, come on back and we'll have a little looky over you, okay?
Alright, I appreciate it, Doc.
We're going to stay with this individual in ICU until a doctor can come and get to him. I will not forget that he is there.
Alright, you are good to go. Alright, take it easy.
Appreciate it. Thank you, Doc.
You're absolutely welcome. Do you two need anything?
Yes, please, if that's okay.
okay.
We don't feel so good.
I'll say, if you're able to, could you go talk to Dr. Skip? I have some critical
of course.
patients. Yeah,
Yeah.
I better just come in. Thank you guys so much.
No problem.
I need you to get this patient as stable as possible. I need to find the doctor because I don't know if she's just been taken or if something else has happened to her. This is not the time for this.
No, I am fine. I was.
Oh, thank God for that.
I was in the ER.
I couldn't hear you on radio.
No, yeah.
And I saw a bunch of clowns and I thought the worst.
No, it's all good. It's all good. Okay. What?
GSWs to the
GSWs?
back. I have combat gauze to her, hung ONEG, saline IV, nasal ventilator. She didn't have a pulse at one point. I've got her back. I've suctioned as much out of her mouth as possible, but she is at risk of secondary drowning. The other one is in ICU stabilizing.
All right, thank you.
Hopefully.
All right, Skip, if you can hook up blood bags and everything, I'm just going to quickly get changed into my scrubs. I didn't put on my scrubs.
Doctors from EMS.
Send it.
Hey, I got another load.
Are they critical at all? Are you there still?
Yeah, I'm here.
Are any of them critical at all?
I wouldn't say super critical. They were just, unconscious and not responsive in any way, shape, or form.
Alrighty. If you can send that lot through to Dr. Skip, if there's any changes in their status, move them to the ICU ward or to the back wall, because I've got the 2 criticals that are here right now. Okay.
Okay, alright. He's already on his way to the hospital. I don't think he knows about Dr. Radio yet.
Oh, okay. Alrighty. Let's start cleaning this out. Let's do a scan of the entire chest and abdominal cavity, because this is a major gunshot wound to the back here. So let's check, see how that's looking all inside. Okay. Okay, that lung is not looking good. Alright. We're going to have to... I'm going to try and go in through this hole that's already here. And we're going to try and fix this... this gunshot wound to the back. Sorry, this lung. There we go. Hook up double bag some O negative blood. Oh my god, I think I'm hyper. O negative blood. Let's get an IV. Making sure that's still going slowly. How is the heart rate doing? Okay. Okay, it's looking good. That's good. Alright. Let's clean this out. Alright. Let's see how badly punctured this is. If it's just the one hole from the fragments, or if it's a bigger issue. Okay. Hold the suction over there for me. I just see the 1 entry wound. Okay. Let me just make sure there's no fragments within this hole here. Okay, suction it out. Alright, if you can give me some of the faux skin, just so we can put this over the top of the hole to secure it in place, so that it's still able to breathe properly and it won't cause any damage. Once if the stitches that I have put in place here, that I'm going to put in place, if it pops, then it'll be fine because of the faux skin that's over the top of it. Alright, here we go. Let's put the stitches in here. There we go. Alrighty. Okay. That's looking good. Let's get the faux skin on top of it here. There we go. Alright. Let's see how if the O2 levels are now gonna rise at all. Okay, it's looking good. Alright, let's clean out all these GSWs to the back here and then stitch them up. Is there anything else I've missed, Dr. Skip, at all? Alrighty. Let's untuck them from the covers on the bed here. Are they going to need to rest in the ICU overnight at all? Or are they going to be waking up in a little bit? Alright, I'll take her back to the ICU ward just to wake up from this. But let's get him cleaned up and then we'll go to see who the other patient is and see how they're doing. Okay. It's Maeve again. Dr. Sip, could you find an ID for me on their person? Just want to see. I thought it was. Okay, this report's going to be called Shot Not Again. Oh my gosh. I feel like her vest might be a magnet. They might want to look into that. I think like there's a magnet on her vest. Alright. This looks all good. So let's get them up and out. I feel like that might be it. I think it's the cadet vests. That is what does it. Like, ooh, easy pickings. That sounds mean for me to say that, actually. That sounds really mean for me to say that. Alright, let's get him up and at him here. Alrighty. Let's take her back to the ICU ward. There we go. Oh, Maeve.
No!
Don't worry, she's just waking up from surgery.
Oh, okay. Can I come in?
I'll say it. Come on in. I might need to have a look at the other one that's in here. Alright, I'll put her in room 2. If you want to watch over her for me.
Yeah.
Alright. Let me go check on the other one. Alrighty.
Maeve, wake up.
Alrighty, let's check their pulse and everything and
I'm
see
not
what's
good at
going on
first
here.
aid, so I gave you to an expert.
Okay, vitals are looking good.
But please wake up.
Let's see. Okay, there is a gunshot wound there. Is there any exit wound at all? Don't think so. Okay. I'm gonna see. Dr. Skip, could you give me the ultrasound machine? I just want to see how close this is to the veins that are within the neck, because I don't know if I have to take them into surgery at all. Okay. Alright, doesn't look like it's too close. Alright.
Maybe she needs to not be on the front lines of a shootout. Maybe just hang out in the back, you know? Back lines. They should keep trying with Bean. Bean goes in the front. He's a
this person
TRT
is very
guy.
lucky since they've got me. Alright. So hopefully they won't lose their hearing at all either.
Maybe like hot
Let's
drop Bean into the gunfire and then drive
this
towards
out
the back.
here,
Let him
carefully and
do the front line
slowly.
stuff, and you can sit in the back.
There we go.
That's what I think, Dr. Skip.
This is just funny to me. I like listen to this.
The doctor.
Fuck this place. Duncan!
How are you? How's your wrist, by the way? Do your wrist feel fine?
What?
Let's see how that's looking. I just want to make sure it hasn't hit the eardrum or ear canal at all.
Cuffed me?
On accident when I was trying to give you medical attention.
Oh no.
How are you guys?
You dead, Maeve?
No.
She almost died. Good.
Get me out of this place.
Okay. Let's go.
Ow.
Okay, this is definitely gone into the eardrum.
Thank you, Doc.
You're all good, okay? You take it easy.
Maeve, are you okay? Feel better?
Okay.
Hey, he's gonna be alright. He's gonna be fine. Okay.
Alright, what I'm gonna do, I don't wanna
Gonna be alright.
I don't wanna do full surgery on it. I'm gonna try and see if I can repair as much as I can right now. But they
gonna be fine,
might
it's
need
gonna be
further
fine.
surgery on the ear canal, which I'll make sure that I do a checkup on them at a later date.
Sorry this happened to you, friend.
Do you think that's a good idea, Dr. Skip?
Don't stress. It's gonna be fine.
Yeah, they heard. I think they heard us in the room.
Oh my god.
It's okay. He said you can have his car when he died.
Okay, here we go.
So you think if you took a picture of him in the ICU, you can try to claim the bounty?
Do not try and take a photo right now. It's against Pippa.
Oh, he's not my son. Fuck. I can't make that decision. And I won't claim him now as my son. No, I'm not adopting him.
Alright. I'll leave him a recommendation that he will have to come and see me at a later date. Do you think they need to rest up in the ICU overnight at all, Dr. Skip?
Doctors from EMS.
Send it.
Hey, I'm coming in with at least another one that is critical, in and out, massive blood loss. Seems to be very slightly confused, but keeps losing consciousness and coming back.
Alrighty. Bring them to the OR and stay there for a little bit, and I will be back in a little.
Absolutely.
Okay. If we can get an ID on this person, just so I can write a report. I believe I have another patient coming in as well. Okay, Jeffrey. Alrighty. Let's get him a bit comfier. They are most likely going to have probably another surgery. They probably have a surgery to their ear canal. They're not going to be able to hear out of their
Is Jeff?
left ear properly.
How bad?
But I will
I don't know
help
how we
them
got an
through
update.
that if they so wish to. Alrighty. Let's get them comfy and let's try and
Yeah,
push
sure, I
something
got
to
an
help wake them up. Upsy daisies. God damn it. There we go. Let's get him comfy on the bed here. Alright. Dr. Skip, I'll leave him in your hands for a little bit. But they should be able to leave in a little bit as well. Okay? Ventura, will you do me a favor? If he wakes up whilst I'm in the in surgery with another patient, do you mind giving him my phone number?
Okay.
Because I'm most likely gonna have to do another surgery for him at a later date.
Okay.
Okay.
Hello?
Thank you.
Take stock.
Yep, yep. Ah!
Is there,
Oh!
is there a
I'm
doctor
sorry, I'm
for
sorry.
it? See you real quick for her.
Alright. Hi.
Is there another doctor, or am I taking her to Skip?
It's just me. If
Okay.
yeah, you might have to take her through to Skip. I'm dealing with the critical.
Yep. Thank you, Perry.
Yep, yep. Okay. What we got going?
Okay. Helen treated her on scene. She's been in and out of consciousness. I'm not exactly sure. She has the quick clot on her. I know she's got blood. She's been wrapped up. I was just transporting. But she's been in and out of consciousness, even on the way here and up the stairs.
Alrighty. Is this the last patient?
I think Helen has 2 more on
two
scene.
more? Okay.
But they might not be critical.
I'll say
I'm
if they're not critical, through to Dr. Skip, if I can ask you a favor, if you are free, could you check on Jeffrey? They're still in there. He's in ICU right now. He should be waking up in a little bit. He will not have any hearing within his left ear. He is. All right. I've basically told Ventura that he needs to give him my number, because I'm most likely gonna have to do a surgery at a later date to help repair that hearing.
Okay.
All right.
Sounds good. And
Thank
there's
you.
also Haley who's in the ICU right now as well. She was brought in there.
I told her. I think Opal took her to Skip.
Okay.
Yeah.
All right.
All right.
All right. I'll go check on Jeffrey.
Thank you, my love.
You're welcome.
All right. There's a lot of GSWs. Okay, let's do a scan over the entire body. I just want to make sure if any vital organs have been hit, or if there's any problems throughout the entire body. Okay, let's clean these out. Alright, how are we looking there? Oh. Yep, okay, I see a few bullets remaining inside. Alright, what we're gonna do, I'm not gonna like fully open up. I'm just gonna go through these entry holes where I can see. And we're gonna go in that way so we don't cause any more further damage. I'm just trying to see if it's hit any lungs or any organs, or if they've just missed them. Oh, that's not good. Could I have called for backup? Yes. Did I? No. Okay, let me have a look here. Okay, there's a lot of bleeding, so there's suction in this hole here, please, nurses. Let's go a little... Alright, I see the lung there. I see a little graze across the lung. We're gonna put... we're gonna try and stem this bleed that's on it, and then we're gonna put some faux skin over the top. That is number 4, I think, of those beeps. That's not good. Okay, that's not gonna do on them shivering. Okay, I hear a lot of gurgling. Could you get me the suction? We're gonna put it down their throat. We're gonna try and suction out the lungs because I believe their lungs are still filled with because I do believe, I mean, they're soaking wet right now, so I'm gonna guess they were in the water. So let's begin suction out of the lungs to remove any liquid or anything that is still remaining inside. If you guys can do that while I repair these holes here and remove the rest of these lungs. Remove the rest of these lungs? Remove the rest of these bullets. Oh my gosh. Okay. I think we got most of the holes there. She did. Let's have a look. Let me just push back the hair here a little bit. Alright, can we do a scan of her head then? Dr. Skip? I just want to make sure that there's no swelling at all. If so, I might have to put some anti-inflammatories.
Echo 4876 in your buns. 911.
You're on Doctor Radio.
Shit, thank you.
Okay, yeah. I'll give her some anti-inflammatories just in case, which will help with the lungs and the swelling that will come back from all that, just in case. So let's clean up this head wound here, just to make sure. Head wound. Today, let me chaos. Okay, think we're looking good there, Dr. Skip. Let's see how the breathing is. Make sure all the liquid is out of their lungs. Let's check their vitals too. How are they all doing? Okay, that's good. Skip, do you think they need to go rest up in the ICU ward overnight, or do they need just a couple minutes and so to come to? Alright, we'll move her back to the ICU ward then, just to wake up. Yeah, I mean, the hit to the head probably will do that. Alright, let's get everything finished up and cleaned up and wrapped up. Skip, if you can find me an ID at all on them, if you have their name at all, that'd be very helpful for me. It's Stevie! Wait, this is Stevie? When did she become BCSO? Huh. I mean, fair enough. Oh, Alrighty, let's get these all cleaned up and finished up. Then they should be good. Okay. I am probably gonna have to restock. I have 3 reports to write. That is probably Jaina. I'm hoping that is Jaina, and that is not one of the other 2. I swear to God. Actually, those other bips could have been DOC, actually, now I think about it. Who knows? Okay, here we go.
TV.
Alrighty, should be the last little bit. And let's get them up and at 'em. Can't do it that way because I have.
Yeah, fuck.
Upsy daisies. And let's get him back to the ICU ward. Alrighty. That's all you come through. Are they all coming through or not? Alrighty. Let's let you rest up in here for a little bit. Oh. There we go. Oh. Skip, stop playing with that. Jesus Christ. Anyway. Alright, I'm gonna let you rest up in here for a little bit. I'll let this little wait with you as well while I'm just outside the doors, okay? Dr. Skip, is that all good? Are these guys good to enter? Alrighty. Alrighty. She should be coming to in a little bit.
Okay, here's I mean, this is Jeff. I don't know if you want to talk to him now.
Keys.
Hello, Doc.
Alright. Hi. Alright. How is your ear feeling?
I can't hear out of the one.
Yeah.
Skip, is Stevie alive?
So the bullet went through into your ear canal.
Oh, Jesus.
So I think it's most likely hit your eardrum. I don't want to do surgery on it until that like gunshot wound is healed. But if you would
Okay.
like, probably in a day or 2, if you want to come back, ask for me, and then I can possibly do surgery on that for you to help repair it.
Alrighty.
Would that be all good for you?
Yeah. I just reach out to you.
Yeah. My number is in the lemon list right now. It is Dr. Peri Watson.
Alrighty.
And then all those other titles that are on top of that as well.
Dakota should be made aware of this.
You're very lucky. I am the ENT doctor here at the hospital, so you kind of got a little bit lucky that I was the one treating you.
How much rest is she gonna need, Doctor?
Phew.
All right.
Bad then.
It's not bad. So, yeah, if you want to come back, I'm going to write report on you just so I have it all down. Could you quickly flash me your ID so I see your state ID as well?
Yeah, sure.
Dakota might have got shot.
1176.
Oh, yeah, he's shot.
1176. Alrighty, thank you so much. I'll get your report written as well. Alrighty?
Alright. Okay, thank you, doctor.
You're absolutely welcome. Oh, I
Hey.
think she's waking up.
Hello?
How's it going, Stevie?
Thank. Ow! I hurt a little bit.
Yeah, ow. I was right.
Yeah.
Woke up, Dr. Perry.
Yeah, I can hear. Hiya,
Hi.
Stevie. How you doing?
I don't know.
You don't know? Alright.
No, my throat hurts.
Yeah. So,
My chest.
you did have a small little nick to your lung.
Oh.
Because you was shot quite a few times. But I repaired the lung, so there shouldn't be too much damage with that in general, okay?
Thank you.
Did also hit your head a little bit. I did have a look.
Oh.
Doesn't look like there is any swelling or anything like that, alright?
Right.
But you might have a headache for a while.
Doc, can I ask a question?
Yes.
Who's the guy next to me?
That is Vincent Ventura.
Oh, I remember him.
You remember him? Okay.
Mm-hmm.
Good thing or bad thing?
I met you when I was interviewed by Peter.
Hmm.
One question.
Yeah?
What department do you think you're in?
LSPD?
Ventura, when did she switch departments?
Like, close to a month ago?
Okay. What rank do you think you are, Stevie?
Senior officer.
That's, okay. That works.
Okay. So you've... Just by the questions, I'm gonna guess you have like a couple months worth of memory loss, most likely.
Oh. Will they come back?
They should hopefully come back. It's a 50-50 when it comes to it. Hopefully it's just from the small little bit of swelling that is there. So hopefully with the anti-inflammatory medication that I've given you, it should hopefully reduce that swelling. If you do start getting headaches or feel like a pressure on your head, come back and then we'll have a look at it again.
Thank you.
Don't try and force the memories out, okay? Don't try and force yourself to remember. They'll slowly but surely start to come back, okay?
Okay.
Alright? If you have any dizziness or nausea, also come back. Sit
Okay.
down, but call, but get somebody to bring you here, okay?
Okay. Thank you.
You're absolutely welcome. You should be good to go. Just take it easy. I recommend Passenger Princess if needed, okay?
I love doing that.
That's good then. Alright.
I think I like doing that.
You think you like doing that?
I can't remember.
Do you like
do?
paperwork?
No.
Oh.
Well, hopefully it's only temporary.
It should. We'll see. It most likely is temporary, but we'll see over the next couple days. I was like, come in for a
Okay.
checkup in like 2 days, okay, Stevie?
Yeah.
All right.
Yeah. Thank you.
You're all good.
Appreciate it.
You're absolutely welcome. All right, I'll let you leave with the BCSO here.
Wait, what?
Oh, hi, Stevie.
Yeah.
No.
You look good.
What am I wearing?
You might want to ease
It's
her
a-
into it, Ventura.
That's your uniform.
Oh. The wrong color.
Look at the pants.
Oh shit. I'm wearing the good pants.
Yeah?
Why?
Because you can wear whatever pants you want.
Oh. Oh, okay.
Oh no, Stevie.
I guess
Oh.
I asked if I could wear these. Okay.
Yep.
Thanks, Doc.
You're absolutely welcome, you guys, okay?
Come on, Jenna,
Cheers.
come
Thank
on,
you so
Jeff.
much.
Yep. Take it easy.
What?
Go.
Jeff, we're going. We're
okay.
going. This way.
Oh, poor Stevie. I know. I can't. God damn it, Rupert. I just need to check if Maeve was actually checked out, because I don't think she was. Let's see. No, she was not. Alrighty, time to write 3 reports. Let me see if there's anything down here. Make sure everything's good. Oh, hello, Carmine.
Hey, my leg's busted.
Your leg's busted. What did you do?
Peach
Oh,
accidentally
Peach.
ran me over.
Oh.
Thank you, Doc.
You're all good. That's what we're here for. Oh, she actually fucked up both your ankles here.
Hello.
Yeah. How's everything going with the whole position? and
Good
stuff?
morning.
It's all good. Hello there.
Hello.
Oh no!
Oh, okay.
What happened to your foot, Carmine?
You broke it, Peach. I told her. She already knows.
What? That wasn't
I'm
me.
at the hospital right now because my back.
You said I'm not allowed to drive a car,
Yes,
remember?
it was, you liar.
How can I break your feet if I'm not allowed to drive an Interceptor? Huh?
Because you did, Peach.
Alright, you always blame me for everything.
There you go. You're all
I
good
hope
to
you
go.
die in a ditch and never get found ever.
Oh, was it? Nice.
Down.
Oh.
Hi. Hi there. What's up?
I was riding a bike and I wasn't paying attention and I blew my back out.
Oh, stand still for me, okay? Let me have a look.
Yeah, okay. Thank you so much. Yeah, how was it? Was it good? Did a lot of people pull up? Cause like, I was working.
Just but breathing.
Alrighty.
If I take skip, if you gotta
Thank
take
you.
these guys, or
So yeah, if you guys can take them to skip. There's only one of little old me.
You know my way.
If you need anything, just give me a call, right?
Okay, let's have a little look
Ow.
over here. Can you hear me?
Ow.
Yes,
How you
I
felt,
can.
Johnny?
Oh.
I had.
Listen, bro, you don't put your harness
I am a
on.
pilot and
I did.
a flight instructor, and
I'm pretty
I
sure I
had the
did.
worst pilot.
Last time you
Worst
said
part?
that you
Oh
didn't.
no.
You don't know
I
that.
jumped from a plane,
I
not
remember.
to burn it
remember
in
shit.
the plane because I knew it will explode, and I jumped too
Not from my
early.
not from my
and,
perspective.
Oh my gosh. Okay, luckily for you, it's not too
driving.
serious. The burns have just cleaned up here with a little bit, so that should help you, okay? If you have any problems, like with any feeling in your, like if you like
Where does it
fall
hurt?
asleep and wake up and like, this feeling gone,
Everywhere.
call 911 and get in
Right.
straight to the hospital, okay?
I'm pride.
Yeah, thank you so
It
much.
should be all good here. Let's get you up and
My
at 'em.
pride was included in everywhere.
EMS to doctors.
Send it.
We're coming in with 8 more officers. To where is my
Actually,
GPS
yeah,
going? Sorry, my apologies. I didn't mean to do that. There are 8
Also,
more officers
Johnny, could you
coming in.
take
Thank you so
them
much.
through to Dr. Skip for me?
No criticals, all stables, all GSWs.
She don't mind waiting though. Is that okay?
Alrighty. Bring them all to the ER. I'll start treating them.
A firm, we'll be a few mics out.
Alrighty. Hi there.
Hi.
I'm gonna guess you was in the plane.
I was driving the plane.
Oh
Yeah,
no.
she did.
Alright, do me a
Bro, it's
favor.
not my fault you don't
Could
put
you
a harness
untuck
on.
yourself from the covers
Your
for me?
harness is
And then I'll have a
broken.
little looky over you. Oh my gosh. Okay. You do have a couple bumps and bruises. Luckily, I
Yeah.
don't see any any bruising that would indicate any ribs that are broken at all, which is very, very good.
Okay.
If anything, it might be just a bit of swelling that will come up.
Yeah.
It's going to ache a lot, okay? Like
Okay.
a hell of a lot. So I recommend over-the-counter painkillers. That should help you. If it continues to hurt, come on back and we'll do another check, okay?
Okay,
Alright.
thank you.
You're absolutely welcome.
I don't think he's gonna let me fly the plane again.
He might do. Everyone learns, okay? Everyone has those mistakes. Just take it slow, easy, have that confidence, okay? Everyone makes those
Yeah.
mistakes, alright?
Everybody has those days. Everybody knows what I'm talking about. Everybody gets that way.
Yep. That is exactly what happens. Alright? So we're going to get you up and at 'em. Here we go. Oopsie daisies. There you go.
Oh, thank you.
You're all good. Any problems, you come on back, okay?
Thank you so much, Doctor. What was your name?
I'm Dr. Peri Watson.
Perry, it's lovely to meet you.
It's nice to meet you too.
Thank you for your help.
You take it easy now, okay?
Okay. Have a great day, Perry.
You too.
Okay, bye.
Bye.
Hi, Day.
Hi.
Can you help my friend?
Also, could you do me a favor? Could you take him to Dr. Skip for me?
Oh, all right. Yeah, no
yeah,
problem.
no, I've got to quickly go do something.
Yeah, no problem.
Yeah, I've got to restock, so...
Oh, it's all right. Yeah, you're good. All right, Bart, Dr. Skip, we go.
I would treat them, but like I want to make sure I have enough for the officers that are coming in. Okay, what do I have? 20, let's do that to 15, 10, 16. I should be good with splints. Okay, let's make 3 reports. Okay, Maeve. Shot again. Okay, report. Medical report. I don't know how to spell his name, so I'll put Jeffrey. GSWs. GSW 2. Their ear. Put Stevie Hale GSWs and head wound.
Patients are now being brought into the ER for you, Perry.
Alrighty, I just had to restock on my way down. Alrighty. Can you guys hear me?
Yeah.
Yeah.
Alright, do me a favor and untuck yourselves from the covers so it's a little bit easier
Right,
for
here
me,
we
okay?
are, Brandy love. Let me pop you in this bed. There we go.
Alrighty.
Yeah.
Okay, let's
1,
do this
2,
quickly
3.
here.
4, 6, 7, 8. We had 8 of them.
There's quite a few gunshot wounds here. I'm gonna clean these out carefully.
Who was it?
Here we go.
I guess I should go to Skip. I'm gonna go Skip.
Alright, this is gonna sting a little bit, okay?
Okay.
deep breaths, and here it goes. There we go. Yep, that's just me trying to clean out all these wounds.
Thank you.
Don't think they're too deep, and most of them, I don't think there's any bullets remaining inside, which is good. That's what we want. So, what I'm going to do is just stitch all these up and make sure that everything is all good, okay?
Thank you, Doc. Appreciate you.
You're absolutely welcome, okay?
The ambos are empty. Yeah. Everyone's GSWs at this point, stable and breathing, and this is the only one that had the bloodstop powder used on them because they had quite a few gunshot wounds.
Yeah, they had quite a few, but luckily they were all few and
yeah.
Yeah.
Lovely.
I'm gonna call it from that from now on.
It's been manic. I'm glad they've come in dribs and drabs for you though. Right, come on, Jackson.
Alrighty, I think we're all good here. I'm gonna help you up to your feet, okay? Any
Thank you.
problems? Please come back, okay?
Will do.
Alrighty, let's get you up and at 'em. Upsy daisies. There you go.
Thank you.
Alrighty, next one along.
Yeah, the doc.
Hi. Alright, same verse, same as the first?
Oh no, I fought off 20 tiger sharks while trying to swim across to the island.
Oh no.
Yeah.
Alright, let's
Yeah.
clean these out for you. Make sure it's all nice and secure. Make sure there's nothing is too serious. There we go. I will say, I think you're lucky. I think they might have just like napped at you. That's the best way
Yeah,
to say
well,
it.
it's because I was so intimidating and I
Yeah,
fought them off
yeah.
valiantly.
Alright, you do have a little bit of a swelling to your foot though, so I will apply some anti-inflammatory cream.
Appreciate it, Doc.
With the swelling on your foot, the best thing I say, and it sounds stupid, is always walk it off. Alright?
Well, that I can do. I got a long walk to get my car back.
Good. Alright, we're gonna get you up and at 'em, okay?
I'm ready, Doc.
2, 1, 2.
I think this might be like 3 times in 3 days. Do I get like a free cup of coffee on my 10th visit?
I need to get stamp cards again for everyone.
Yeah,
We
that'd
used
be
to
good.
have- we used to
I might
have
run you
them.
out of business though.
Oh. No, I think there'll be more people like this one right in front of me.
That's fair. Thank you, Doc. I appreciate you.
You're all good. Take it easy. Alright, can you hear me? I don't think they... Oh, nope, there it is. Hello.
Hey, D.
Oh.
Hey, Karen.
I think I'm gonna have to push you guys with your training, aren't I?
Yes, please.
Oh
Looking
my, oh
forward to
my.
the physical.
We are probably gonna need some of the officers.
Can you call Ventura? I cannot leave you alone for 5
Can you
seconds.
call Ventura?
Officers' cars.
There's only like
Will
one
be
and
Tell him
ill.
I'm going off duty after
There we
I
go.
get off this hospital
This is
bed
gonna
and
sting
that
like
I
a
can't
bitch.
retrieve Remelo's stuff.
Here we go.
Not wrong.
There
We
we
can go get it.
go.
No.
We can go get it together quick.
You know what? No, I blame you.
Where is it? Wait, was it the Buffalo Lights? Or...
Alrighty.
Yeah,
No, it was Remelo's because I was with
I
him.
think this looks
Remind me
good.
Target.
What the fuck have I done?
You thought back, that's what happened.
Oh, Jesus Christ. I have a backbone.
Imagine. Can't
Don't
relate
like
to half
men with
the back
backbones.
after that.
Alright, you are looking all good, so we're gonna get you up and up. Is that Remy behind me?
Probably.
Hi.
Oh my gosh.
No, you should have seen the adventure it was to get evidence. There was evidence in a tree, and there was like 5 of us trying to reach it, and 2 of us ended up going off the cliff, following the others' advice of how to try and grab it.
Fair enough. Could I ask a favor of one of you to do once I help Remy in a minute? I've just noticed underneath the bed you're in, Remy, there is 2 pieces of evidence underneath there, and I need someone to grab that because it's going to irritate me. It is going to irritate me.
I'll grab
Oh my god, you're in for a lot more than this, by the way, darling. Get ready.
Is there more?
Yeah.
Oh
this
my
is
gosh.
like probably the smallest batch, I feel.
I was gonna say I've already had a lot of you guys. I'm perfectly fine with it.
Maybe it is. Just I don't know.
This is not the worst. I've had worse during Sanguine. Don't worry.
Oh wow, you were there for that?
I
Wow,
wasn't there.
Wow.
I was the like coordinator at the hospital at the time.
Yeah, that's what I'm
So-
saying. It's like,
Yep.
wow, that's a lot of work, huh?
I think it was
That's to ate it
50,
up, though.
60 patients.
Damn, I did.
All right.
Oh, so you fell on
Could you
purpose?
untuck yourself from the covers for me?
No.
Yeah.
Should
Thank you.
knock me down the hill.
Alrighty. Let's see here. Ooh. Alright, you do have a couple little bumps there. Which I'm gonna clean out. This is gonna sting like a bitch. Alright? 3, 2, 1. There we go. Just cleaning out the area for you.
Thank you.
You're absolutely welcome. I'll say, is it everyone's chatting around here, aren't they?
Yep, nope. I would be in the ICU if I was.
Fair enough.
I wasn't fucking. I'm a survivor. That's all I gotta say.
Alrighty. That's what we want. We want you guys to be chatty, be awake. Because we need to get you guys back out there. Alrighty. I think this should be the last little bit. Just double checking. Yeah. Let's get you up and at 'em, okay? Any problems, you come on
Yeah.
straight back.
I will. Don't worry, darling. Thank you so much.
54. Upsy daisies. And there you go.
Thank you.
You are welcome. Alrighty. Next in line.
Ah, it hurts so bad.
It hurts so bad. Let's get
Yeah.
lucky. Ooh. Okay. Alright. This is just me gonna flush the wound, okay? This is gonna sting like a motherfucker. Here we go. There. That wasn't so bad, was it?
No, it could have been worse.
Yeah. I'll make you think it's gonna hurt, and then it's more of a, oh, it's like a tickle.
Yeah.
See? Sometimes you gotta say, oh, it's gonna be really painful, and then you expect it's gonna be painful, and it's like, oh, actually no, it's not that bad.
That's a really good strategy.
It's like when like you get an injection, and they go, you're gonna feel a small little prick, and then it's like
And you never feel anything?
you never feel anything. It's like, oh,
Yeah.
okay,
Crazy.
it's actually not that bad. So there we go.
They should do that before they mow me down with class 2s. They should be like, yeah, it's not going to hurt that much.
It's
and
not
then
gonna
shoot me.
hurt.
Rather than just dumping a whole magazine into my vest.
This will hurt a lot.
This might kill you. Then maybe it won't kill me.
What was that number? 15? Upsy daisies? There we go. You are all good.
Thank you. Thank you.
Alrighty, next one in line. No, I'm joking.
You can leave me to die, you'll be fine. Then I won't have to do anything tonight.
That's crazy. I need you.
I was like, would you like me to leave Remy? I can leave Remy.
No, I need her to teach tonight, please.
I'm actually not on it. Right, I'm not on any modules tonight. I don't have a module till tomorrow.
Oh.
Fuck. You're in my entertainment tonight.
You're my entertainment for tonight. I mean, if trying to get evidence from a tree is something, then
No, we
fair.
got an academy for shift 3 tonight.
Why the hell are you awake right now then?
Good question.
Thank you,
Shift three
see?
are psychopaths.
I'm on my third shift.
Jesus Christ.
What the fuck? Yeah, she bravoed.
I'm
Did
trying
you
to
get enough bullets
I haven't been up that long.
No.
You haven't been up that long? Okay, how long is that
Give me a
long?
lift down my PD so I can get more.
Like 2 hours.
I don't know if I even have a course.
And how long were you awake before that?
Drake probably came back and stole it.
I don't fucking know.
See? Alright, let's get you up and at 'em.
I went to bed at like 7 and then was up at like 5 a.m.
6.
4 a.m. So I ideally had like 12 fucking hours.
Fair enough. Upsy daisies. And
actually, no, I went to bed at like 4.
Fair.
Hi.
Hi.
I fell down a hill.
You fell down a hill.
Yeah.
Oh my god. At least it's not that bad then. If you just fell down a hill. Oh god. Oh, maybe. No, I'm joking.
Oh, how bad is it?
It's not bad.
Give
you
it
just,
to me.
You just
Give it
got
to me
some.
clear.
You got some it sounds weird. It's called like a grass rash, but like you basically slide down a grass banking and something. Sometimes, yeah, you kind of got that as like a rash. So this is going to hurt when I clean this out. Okay. So
Oh no.
Deep breaths, and here we go. There we go. See, it wasn't too bad, right?
Thanks for the warning.
Yeah, I have to get the
Help me
warning.
prepare for it.
I'm not like those other ones that just go. And it's done. Oh wait, what? All right, you should be good. Any problems? You come on back, okay?
Okay.
263.
She's currently treating somebody, but I don't know if she's free after.
No, just no, in the other.
All right, upsy daisies.
Yippee!
There we go. Alrighty, you guys take it
All right.
easy, okay?
Awesome, thanks.
You're absolutely welcome.
Let me go drop off this evidence and then we'll go to
Okay. Alright, let's start. I'm gonna hide in the back room. If they need me, they can just radio to me.
Oh.
Do you need help?
I need help. Yes, very much.
Oh. Come here. I'm gonna guess you had a little cut.
Yeah.
Oh my gosh. Let's get you up on the
few.
bed.
Thank you.
You're welcome. If you can untuck yourself from the covers for me, and I can have a look over you. Alrighty. What happened to you?
A few bad guys. That's
A few bad guys?
yeah.
Alrighty. We'll clean all this out then for you and get you up and at 'em, okay?
Thank you. Are you Peri?
Mm-hmm.
Oh. Well, I remember last time I was here. We had a conversation about bucket seats, I think, or just a bucket in the car, or the car is the bucket.
Yes. Yeah, where the car is the bucket, like in
That's
SpongeBob.
funny.
Yes.
Yeah.
Yeah, that was us. I'm surprised you remembered that conversation.
That's the last time I was here, I think.
That was a while ago.
I came to check if you were here working, but it was just
Yeah.
empty. So
Yeah, I'm like half and half. I've been like busy with patients, so it's a little harder.
So cool.
of course, understandable.
Wow, wow.
I've been in and out myself.
Oh, there's a lot of people. Okay, Pico.
Pico!
Wow, nice
Wow,
bed.
Pico,
wow,
bed.
nice bed.
Pico,
Sit.
wow, nice
We
bed.
Sit bed. Sit bed. Wow. Oh.
Some free entertainment walking in.
Okay, you stay. You stay. Stay. Oh boy. Doctor, when you're done with this clearly a gang member individual, can you
What?
help
How
us
dare
with
you.
somebody that's really in bad shape?
Yeah, I can help you with them.
Thank you. Wow, Pico.
Do I look like I'm in a gang?
Slightly masked up and everything.
Pico.
Wow.
Stop.
I thought I was just,
Stand up.
dressing fashionably.
Up. Oh, good. That's
It
good.
can be.
Oh, wow.
It can be to some people.
Yeah, good.
Alright.
Good.
Nice, just gonna
Good.
stay a little bit. Here we go.
Oh, boy.
And there we go. Alright, you should be good to go, alright? I'm gonna help you up.
Hmm.
Here we go.
I'm ready.
I'm already sick. Oh, God.
Upsy daisies. There we go.
Ah, thank you. Did you say to some people about my fashion?
Some people, yeah, no, because some people think that
Have a
will think
drink.
it's
Maybe this'll
possibly a
help.
you're possibly a gang member.
Oh right, yeah. Now what do you think? Do you like it?
I think it's nice. It is really nice.
Oh.
I
Yes,
gotta
it's
go.
tracksuit for aero. Oh, of course, no, you gotta.
Yep.
Yeah.
Alrighty.
Good one.
What's
Wait,
going
I
on,
don't- he-
Chatty?
Well, he has a bunch of bandages on his head. He's
Oh.
repeating everything I'm saying. He doesn't. I think he's stupid.
Have a little sit down for me.
Pico, sit. Go sit.
Sit, Pico.
See, look at this. I don't know what's right. He was just walking in a mountain. He's something's wrong with him.
Walking in a mountain. Mountain and walking.
What happened?
What happened?
Oh, he's also copying me. You like a mimic?
You look like a mimic?
No, I didn't say you look like a mimic. Alright, let's have a look at your head here, okay? Let's see what's going on.
What is going on?
Just so you know, he is
What
a cop.
is going on? He's a cop.
Wait, this is a cop?
He's a cop.
Pico is a cop.
What the?
Pico is a cop.
So I don't know if that's something's happened to him or not, but you'd think that the department would take care of him if something did, right?
You would think that the department would take care of him.
Oh, jeez. Oh,
This is not good. Okay.
Is there, what's wrong with him?
I don't know.
What is wrong?
What is wrong with you?
Hmm.
I think is ever a brain scan on him.
jeez.
We might have to do a brain scan.
Alrighty. Upsy
God.
daisies.
God.
Let's get going.
Uppies,
daisies.
Pico, uppies.
Uppies.
There we go.
Uppies.
Uppies.
Now, look, follow. Pico, we go there. Follow.
Because he was saying like me or him, so I thought he was talking in like the
There you go.
in the other part.
Oh, Pico, wow.
Wow.
Chatty is babysitting.
Wow.
Yeah. Wow.
Wow.
Doctors from EMS.
Send it.
Hey Perry, I'm gonna be coming in from Polito.
I'm worried about him.
In a few minutes. I do have a black tag, folded
Oh.
much, no pulse.
Wow.
Wow, door.
Alright, if you want to move them to the ICU ward for me,
I'll
once I
move to
deal
the
with another
ICU
patient, okay?
ward for me.
Okay, and I have an ejectocito and one patient that is up but non-responsive, just staring blankly.
Alrighty. I'll have a check over them in a minute as well once I have done with the scan and everything.
Of course, absolutely.
Alright, this way. This way.
Uppies, Pico.
Come on.
Uppies.
Alrighty, let's get you guys back here. Come, follow me. Follow the leader.
Follow the leader.
In here.
In
And
here.
then go in this one here. Do you have any metal objects on you?
Do you have any metal objects on you?
Okay. Pico, hands. Up in the air like you don't care. Yay! Yay, Pico!
With your
Put
hands.
your hands up if you're happy.
Put your hands up,
Yeah.
happy Pico.
Oh, yuck. Put your hands up if you're happy, Pico. Ah, hands up in there.
Hands
yeah.
up, happy Pico. Hands
Tickle,
up.
tickle. Keep those hands up, Pico. Just looking. Okay, just looking.
Keep those hands up, Pico.
Jesus, yeah. Oh yeah, he has tons of metal on him. Oh my god. Okay.
When you say tons of metal, what do you mean by tons of metal?
Well, a camera has metal in it, and a microphone has metal in
Yep.
it, and a tablet,
Yep.
and a repair kit with tools.
Yep.
He has prosthetic legs. Should we take those off?
Is the metal within the prosthetic?
I would imagine. You know what? We're
Oh,
taking prosthetic legs
no,
off.
yeah. Look, there's those are metal.
Okay,
All right.
I'm just gonna take. I'm gonna take his phone off him too. Anything metal. I'm just gonna take everything metal. All right, and I'll give it back to him.
Okay.
Okay.
I'm gonna I'm gonna help you up, okay? And we're gonna move you to the bed in there.
Move you to the bed.
Yeah.
Yeah.
Oh my god. Doctor, I'll make sure I'm out of your way here.
Yeah, I'm trying. This door is so heavy. I can't open the door.
Okay, I got you. Hold on.
So I got it. Yeah. There we go. In you
Here we go.
Alrighty.
Here we go.
You're gonna hear a big washy sound and everything, alright?
You're gonna hear a big old washing sound.
Alrighty. We're gonna turn on this machine here, okay? And we're gonna see what's going on with your head there, alright? In 3, 2, 1.
Whoa!
Whoa!
Okay, let's see here. What are we looking at? What's going on? Oh, what the hell? What the hell? Ow.
How the hell? How the hell?
Okay, this is peculiar.
This is peculiar.
Yeah, this is peculiar. Alrighty. Let's get those prosthetic legs back on you and you can come back out here, yeah?
Yeah. Okay, I'll bring those back to him.
Yeah.
Yeah. Yeah.
Let's get you out in there and then we can put them back on you. Alright?
Let's get you out in there.
Are you stuck there, Chatty?
I'm having a hard time. I need an adult. I'm having.
Was there any?
Sorry. Yeah.
I'm at the hospital.
DOA.
Are the other 2 patients okay?
They're in the side rooms. One was conscious, and the other one was standing, but was absolutely non-responsive, staring blankly forward. Didn't appear to be injured. The first one, or the other one, was an ejectocito on a C-collar spine board. It looked like he had ejected, maybe hit a tree, and then possibly got run over because I saw tire tracks.
So would you say they're critical at all? Because
in my opinion, no, because he was conscious.
He was conscious.
You want presents?
You want me to have them run them through Skip?
You want presents?
I'm trying to like, because my chain of thing is literally
you want presents?
black is at the bottom.
You relax.
Yes. Yeah, maybe the.
If they're
maybe the guy
when
that
you
got
say
run
they're
over.
unconscious and staring into space, do you mean like a purple tag almost, or
No, like
you want presents?
possible head injury? Oh my god!
Possible head injury. Yeah.
Here.
Pico has a problem.
Yeah.
His
Okay.
All right, you guys want to leave for me, okay?
Yeah, okay, we'll leave
Pico,
from here,
we'll give you a call. We'll give you a call later at a later
You
date.
open the door. It's me, Officer Roberts.
It's me, Officer Roberts.
I'm gonna need you to open the door for me, Officer
Hold
Roberts.
on, Perry. Don't open the door.
Officer Roberts.
Harry, it's fine. It's me, Officer
No,
Roberts.
Perry, come down here.
It's Kirk Jerkums. It's Kirk Jerkums.
1 second. It's possibly Kirk Jerkums.
There's no Officer Roberts on duty right now.
Yeah, no, it's probably Kirk.
Sirs,
Send it.
I have one Paulie D. He fell over in the water in a car.
If you can send D to Skip for me, that'd be great.
If you can send D to Skip?
That's fine. Yes, thank you.
Alright.
D?
I'm gonna let you guys out, okay?
Okay.
No clowning around in the hospital.
No clowning around in the hospital. No clowning around. It's No just Kirk.
clowning
around.
Okay.
It's just Kirk.
It is just
Yeah,
Kirk?
Just
Kirk.
Yeah, I called him to come here because
Come on.
to help me with this.
Off you go.
Okay, thank you. Thank you.
If he's still having problems, bring him back, okay?
Well, I'm okay. You think so? He's gonna be okay? I didn't like that answer.
Give or take.
Okay.
Just
Does he have inside out brain again?
Yeah.
Just like his dad?
Inside out
Jesus.
brains.
Oh, fuck.
all right.
All right.
All right, doctor, we're gonna need you.
All right. Let me have a look at these patients, and then I might have to go. I'll go look at the autopsy in a minute.
Yeah.
Okay.
Hell of a day.
It's fine. People tell me I don't do work. It's fine.
Yeah. Send him my way. I'll punch him in the face.
Which room?
Side room.
Sorry, did you guys deal with the DOA?
Not yet. I have to deal with patients that are living first before I deal with the DOA.
Okay, that's fine. That's fine.
Yep.
Okay, I'll wait over there.
All right, thank you. If you want to let her back in there so that she can keep an eye on the DOA, let her do her checks and everything.
Oh, my savior.
Alrighty. Hello.
Thank you so much, doctor.
Hi. Alright, what happened here?
Got launched out of a car into a tree and then run over.
Oh no. Okay. I think you've
not
been looked
fun.
over pretty good, but just a little bit more, and you should be good to go. Okay?
Thank you, thank you. I can wiggle my toes. I feel them.
That's good.
Oh wait a minute. Nope. Yep. Okay.
You can feel it?
We're good. We're good. We're good. We're good.
I was gonna say,
Oh.
you can't feel it, I
Ooh.
swear. Whew.
Oh gosh.
Could give us a
Oh,
heart
God.
attack. Alrighty, let's see here. 1, 2, 8. And
Gotta double check. It's one of those things you think about it and you can't do it. You know.
oh, well, it's fair. How is that person that you're with there?
Well, she's unresponsive. I tried getting her to look at a lane, but she's just staring blankly in front of her. So she might be on something. Unsure.
Alright, I'm gonna have a little looky over them.
She might be Secaucus.
Let me just check for any head injuries.
Don't say that about her. I'm sure she's a fine lady.
Okay, her pupils are very big. Okay, let me just try and flash a light here just to see if the pupils react at all and retract.
Yeah, no problem.
Dark is not on this channel anymore, Maeve. You went back to channel 3.
Okay, then I'll check anything. All right. What I'm gonna try and do, I'm gonna get a blood test here. I'm just gonna prick their finger here and test for any narcotics or anything that might be in their system.
Yeah.
Let's have a little looky here. Just give it a little shake here. Okay, that's not coming up with anything.
Alright, I'll get them both in the turkey.
Huh.
I gotta find something there either.
Alright.
Get this lady
This
into an
mask.
MRPD interrogation room, okay?
Alright, yeah, we'll do.
Alright.
Appreciate that.
Can you help me with this mask?
I am going to, I need to take him back to it, get a scan, just to see if there's anything going
Yeah.
on, because
Yeah, from
this
a little
is
bit of backstory maybe that helps.
Mhm.
She was in a car crash. She remained in the vehicle, did not fly out of it. She was on the phone. She then went on a pursuit with the officers, where she got either tackled or tased and then put in cuffs. So up until that moment, she was reactive. After that, she hasn't been.
So she kind of possibly hit her head maybe as well.
Essentially.
Okay. Alright, I say that because I don't see any injuries, but I'll do a scan just to see, because it might be
Yeah.
something internal. Ugh, this door isn't opening. I'll say you want to follow me just in case.
Yeah, we'll do. We'll do.
Okay, let's go. Let's go, let's go. Okay, there we go. Alright, let's lock that door.
Did you?
Okay.
Hold on.
Alright, I'm just gonna let the officer have any metal objects at all. Alrighty. Do you want to make sure that there's nothing metal at all on her before I put her in?
Of course, of course, of course.
Even though it's gonna be an X-ray, I just want to be safe.
Yeah, of course. Alright, ma'am, I'm gonna be searching you at this point, just making sure you don't have anything on metal. Which you do, so I'm gonna be taking that off you for now. You'll get that back, don't worry about it.
So I've got everything I need. He just needs the autopsy. And I need the name of the doctor doing the autopsy, I think that said.
Peri Watson.
Okay.
No injuries. No. Drugs.
Second, I'm gonna have to quickly move on. I have to rule. I'm gonna have to put a repair kit on before for a second. I'll pick it back up later, man. Oh, I did not close that door. I never did. I wasn't even close to it.
I don't know what you're talking about.
Get these out.
Alrighty. Then I'm gonna set up the scan here. In 3, 2, 1. Let's have a look at her brain here.
Do you need me to make a processing?
Yeah. Oh my god. That would be great. I'm gonna go out back and work on my.
Any Jackie. Oh dear Lord.
Just looking back.
Okay. I know. Okay, this might be. I might just need to give them some anti-inflammatories and stuff to help. Help right now. If this is who I believe it is. If this is who I think it is, I might have to also call in another doctor too.
Who do you assume it to be?
That's the thing, I don't know like, if it is who I think it is, because there's only one patient that I know who has this problem going on. That's why I need to
liberty of like tell me who it would be?
It would possibly be I believe it is Miss Creed, possibly, but I don't know for sure.
Okay, alright.
Okay, let me just double check here. Okay, oh
my.
Dr. Skip, do you recommend that they go into the ICU ward whilst we give them some anti-inflammatories and stuff? Possibly. Okay. So if we just give them some stuff to help reduce reduce what's going on right now, kind of kickstart her brain again. Almost. Do you think that would help if they rest up in the side room for a second with PD? I'll also make note of this if it is who I believe it is. Let me just see if I can find a medical bracelet or an ID until on them to see if it is who I believe it is. think I can't find anything. Alright, we're gonna move her back to the side room then for the time being. Just to see, because I think from my guess and looking at how the brain is, this might have been just a distant seizure.
Okay.
Alright, I'm gonna take her back to the side room for you
okay,
guys.
okay. Thank you.
Okay. And then I'll go handle this DOA in a second as well.
Yeah, thank you.
Okay. I can't open these doors. Oh my
The
god.
doors are really good. Hopefully this helps.
Yep, thank you. Alright, let's lock that. Okay. Alrighty, let's get them back here. Alrighty, let's get them comfy here in the bed. Alrighty. Okay, how are the vitals looking? Let's get them hooked up to some vitals for the time being. Just while this is going on here. Yeah. Okay, let's try and get something to help lower the BP a little bit, just for a second, just to see if that helps. Are they good to be resting here for a second while I wait for with the officer while I go deal with the DOA? Oh. Let me just clean this out here. It can be Jane Doe. Okay. Yeah, I haven't found any ID or anything, so I don't know for sure if it is who I believe it is.
Yeah,
So,
no, I found an ID on her coming back to a Miss Sky, but we'll confirm it at MRPD.
okay.
Oh, my priority right now is that she's fine first.
Yeah. Right now I'm just gonna clean up her nose here because she's got a lot going on right now. Okay, let's clean up her nose here. Make sure it's all good. Alright, there we go. Alright, how's the vitals in that looking? Okay, this is bleeding pretty badly here. Come on.
Hey Bruce, we're here for support.
Thank you, thank you. She's still getting medical.
Okay. Blood pressure is at a good spot. Alright. She said she didn't want ICU.
We're still at the hospital. The lady with red hair is getting medical at this moment. Okay. Please check the latest 311 if you haven't yet.
Alright. I think that looks good. How's that looking, Dr. Skip?
Yeah, I will inform you once I got more information here.
I'm pretty sure the only sex you can have with a lesbian is gay sex.
What?
What?
Don't worry.
Oh,
What? What? Am I wrong?
You were yelling.
Sorry, sorry. Nice.
Want to make sure that goes in the report. Yeah.
They're fun.
No, negative.
I'll let you know if it is her, and then if you want to meet us at MPD, yeah?
Alrighty.
Perfect. Bye-bye.
Let's have a look at her pupils, see how the pupils are looking now.
Sorry, guys. Sorry. Sorry.
Don't apologize. It was in lightning.
Listen, someone told me on the phone I'm trying to have gay sex with a lesbian. I said, what other kind of sex can you have with a lesbian?
Alright.
Fantastic
crazy.
sex, probably.
True, true.
Hospital's channel 4, right? Radio check.
Yeah, affirm. Then two.
All right.
I believe Sir main facility DOA.
Yeah.
Alrighty. Yep. I'm literally having to wait until
okay. Have you
she comes to,
contacted
because
Remy or we're
from
still waiting? We
sounds from
don't
the
know.
way it's explained, it's like a distant seizure. So I'm just waiting for her to basically come to.
Yep, just give me a sec.
Come on.
I just spoke to her.
Are you dead?
Okay, let's see how the nose is looking, if it's bleeding anymore. Okay. I'm gonna start some reflex tests just to see if she's starting to respond. Let's do some slight clicks here. Let's see. Can you hear me? Okay. Dr. Skip, do you think they need to be monitored in the Do you think they need to be monitored in the ICU? For a little bit. Not overnight or anything, just until she comes to from what I'm gonna guess is a distant seizure. Okay. Everything's looking good. She's stabilizing that, but I just need
Were you saying something to me, Doc, or were you saying something to yourself?
I'm talking to myself. Yeah.
Oh yeah, just making sure.
Yeah, I'm talking to myself and Dr. Skip. Don't worry about it. As I just step back a little bit, because
Yeah, of course.
because I still want to just make sure. Okay. Yeah, this is what's confusing to me. It's like, what do I do? Alright. I'm just going to... I just want to see if she's going to react at all. Let me just raise her arm up here. I believe she's just I believe she's just cuffed to the bed.
He was falling. Gotcha.
Valdez.
Oh? Hello, can you hear me?
Hello.
Hi. How are you feeling there?
What? Where am I?
You're at the hospital. How are you feeling?
Oh. How did I get here?
I believe you took a little like shake to the head. I believe.
What?
That's fine, no.
Which caused you to have a small seizure.
Wait, what?
I'm gonna have a PPO.
Yeah.
Oh, that just happens a lot.
Is it like a distant
Well,
seizure?
no, not because I don't think you're capable,
Yeah,
because
I
you shouldn't
guess.
have to.
Listen, I am not capable. I can tell you right now.
Do you mind telling me your name? So I can write this report.
Yeah, I mean, I had to
Remedy.
prosecute the first degree
It
murder
is.
when I was a PPO, and that was fucking horrible.
Okay.
The amount of mistakes that were
I
pointed
thought
out
it
in the
was.
trial that could have been avoided.
I've seen your record, so don't worry. Okay?
Is insane.
I'll let Jackie know. Okay?
Can you call Valdez?
Hmm?
I do have most of her possessions currently because.
Can I do what?
Can you call Valdez?
I don't know who that is, unfortunately.
It's on my emergency contact list.
She does seem responsive now, so.
Do you have an ID?
She did, yes, but
The problem is I don't think I can because I think the police have detained you, so I don't know if I can call your emergency contacts. Is the problem.
I do, but I wasn't
fine.
the original arresting officer for
Alright.
her, so I didn't. I don't have her firearms either. Carmen has those.
How are you feeling though? Are you feeling a bit better and everything?
I'm fine.
Alright.
10-2.
Okay. I'm gonna let you leave of the offices now,
I'm
okay?
not sure if Peach or Carmine took it.
If you have any problems, you can feel free to call me, alright?
I'm gonna try and get it from Carmine.
I don't think I'm going to be able to do that. But...
I'm gonna kill him.
Oh, you can still try. But I'll let Dr. Lex know, okay? And he'll help you. Alrighty. I believe you are good to go, alright? I'll leave you with the officers, okay?
Can you confirm if you have the weapons of the female with the red hair?
Please take it easy, okay? Alrighty. She should be good to go for you guys. Just please take it easy with her, alright?
Yeah, we will.
Alright. I'm gonna go deal with the DOA now.
Alright, thank you, doctor. I appreciate you.
How many reports is that? I jokingly was making a joke that I'm gonna do 6, but yeah. Alrighty. Sorry that took so long.
It's okay.
All right. That's it. If you
He
want...
might be in a deep
deep
death.
deep. Okay. So good.
Maybe I'm not sure. He might be out cold.
Out cold? Oh god. Do you have an ID on them and everything?
Yeah, I gave it to the EMS. Here you go. There it is.
Thank you. George Porter. Alrighty. I was like, you've done all your looks and everything?
Yeah, I've taken everything off him that I need to, and I have documented everything basically. So
okay,
he just needs an autopsy now.
Yep, I will get that done for you guys.
All right.
If
do we need to be here for that, or
you can stay here if you want to be. If needed. But I think you should be good. The autopsy you should be able to see it. Actually, let me get the thing up now so you guys know which report it is so you can tag it for you guys.
Awesome, thank you.
Autopsy. I'll say, do you know where they were found and everything?
Yeah, Polito, Procopio Beach, like by the hunting lodge.
Was there any like blood or anything around?
Yeah, there was a bunch of casings. So I believe there was a shootout. There was a blown up car. I'm not exactly sure what happened to him. We got there and he was like cold.
There. Okay. Alright, the report is already up. But I will start. I'll write the report up for you guys. That should all be good.
Okay. Yeah. Last time I checked, I couldn't think. I don't know.
Was
He's
Skip?
out cold.
I was like,
Last time I checked, he's out
Skip
cold.
just chilling in the corner there? Is that basically it?
Yeah. Yeah.
Okay. Perfectly fine.
For a few
yeah,
minutes.
I have his name. I have his name and ID, so don't worry.
You'll probably be able to get something, some info soon from Skip.
That's all good.
Yeah, I think so. Thank you, Peri.
You're welcome. Okay, let's just check. Okay. I have so many rough notes right now, it's bad. Okay. I don't know if they're two or not.
Doctors from EMS.
Send it.
Hey Terry, I got another black tag coming in for ya. Looks like a GSW. To the head, no pulse for at least 4 minutes. Is on Lucas and oxygen.
Okay. Bring them to the ICU ward. I will look over them after I've looked over this one. Okay.
10-4.
Fuck. Alrighty. Dr. Skip, if we can get a blood sample to check their toxicology. Make sure there's nothing within their system at all. Any alcohol or any drugs. What I'm also going to do, let's do a rough estimate of when they may have passed at all. Do you have a rough estimate, Dr. Skip, at all? And then we can start from the head and work our way down. I love my DOAs. Alrighty, starting from the head. Oh, Jesus Christ. Starting from the head and working our way down. We're gonna look for any injuries at all. Anything that may come out to us. Let's start looking over the head here. Going down the neck. I do see a gunshot wound in the right ear. Don't see anything on the neck. Looking around it. Yeah, there's one going through the ear. Okay, looking at the shoulders, there is quite a few, specifically on the right shoulder. How is the left shoulder looking? Let's see. Looking at it. Left. Two GSWs. Okay. Moving down to the torso and the back. Let's see if there's any that are down here. Ooh, 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 these ones are going all the way through. I can see the table. Okay. Okay, looking down the leg here, there's quite a few grazings on the right calf and thigh. On the left one, I do see a couple GSWs to that leg too. Alrighty. Let's do an x-ray. I just want to see if there's any broken bones or anything throughout the body as well, just to double check. Definitely not bad aim. Okay. Ooh, that femur. Oof, oof. Alrighty. Okay, and along with their left arm. Yeah, I can see one fractured there. There's another one there. I think that's also one down there as well. Oof. Whoever shot was actually... These are actually quite interesting. Huh. Alrighty. Alright. Is that everything, Dr. Skip? Did I miss anything at all? Alrighty, I'm going to guess, due to the state of the body and everything, and the fact there's GSWs and everything, I'm going to guess most likely the cause of death is going to be exsanguination, which is blood loss, and it's 100% a bloody homicide. With this many GSWs, Jesus. Alrighty. I think what we're going to do, we're going to get them up and at 'em, and let's move them back to get washed up before being taken down to cold storage. Is that all good, Dr. Skip? Just want to make sure that they're not bleeding. Alrighty. Let's make sure this is all looking good. Oop. Yes, I just messed up and accidentally put a tourniquet on straight away before anything else. Oops. Alrighty. Let's get them up and at 'em. 437. Alrighty, off the bed here. Alright, let's get him back to the... get cleaned in the ICU area. Where you can take him to cold storage, Dr. Skip. And it should all be good. I believe PD has got all their notes. Oh, hello.
Hello.
Hey, Perry.
Alrighty. There you go. Alright, nurses, if you can clean them up for me, that would be great. Alrighty. Alrighty. What do we have here?
Okay, GSW through and through to the head, no pulse. Rupert was doing CPR on him for about 4 minutes until I got there. As soon as I got there, I tried to pack and bandage the head wound as best I could. However, there was brain matter on the pavement, so I hooked him up to oxygen, saline, blood, and Lucas machine. Trying to do the best I could.
I will have a look, see if I can try and see if there's any pulse or anything.
He's really fucked up, Doctor. He's really, really, really fucked up.
Alrighty. Don't worry, Rupert, I've got this. Okay. Let's check their vital signs here. Let's check for any, if there's any... I've lost my words. I've lost my words. If there's any electronic signals that basically, for me to be able to jumpstart their heart at all. Is their heart going at all? Is their breathing going at all? Or if there's anything I need to know. Okay. don't think I see any chance of possibly bringing them back from this. All right. Time of death is going to be 9:36 UTC. Alrighty. Rupert, have you done have you done everything that you need to do with the DOA here?
Yeah, I'm just wondering if Skip's going to be able to give us any information on whom he is.
Is he had so that's what you do your ID for and check for ID and stuff.
He hasn't got an identity. He's got no ID on him. Yeah.
Oh.
His name is Jonathan Doe, as it stands, Doctor.
We don't normally call him John Doe because last time there was a John Doe, there actually was a John Doe that was alive and people thought that John Doe died. So they're called random Rickies.
Apologies, Monsieur Ricky. I don't know who he is, Doc.
Okay. Did you get any fingerprints or anything?
I've not been able to do so. I'm not entirely sure whether I can fingerprint an individual. I certainly can't do it in the field. Do you have a fingerprint machine here in the hospital? I don't think you do.
Have you ever done a DOA before?
I was assisting a DOA when I was a cadet.
Okay. I'll say if you're confused of what to do, the best thing to do is ask one of your seniors. Okay.
Yeah, let me get some help.
Yeah, I'll say get some help quickly, and then I'll start the autopsy.
Gunner 395, your comms. Or Wade or any other unit.
Yeah, I'm also like letting him learn how to do this. Okay, what I'm going to do, I'm going to take a blood sample just to run it against a tox screen to see if there's any alcohol or drugs within the system at all. Alright, thank you, Dr. Skip. You can take that sample there.
An ambulance while you're doing your report, just in case we get any calls.
Alrighty.
I'm gonna go smoke a cigarette while I work on this report.
That's smart.
Yeah, I know. I want them to learn.
Nothing but $100 cash.
Okay. Alrighty. Are you gonna do?
That's you.
Oh, that's me. That is me.
Yeah. Okay.
You have just.
I need to go get a DNA kit. Sorry, I was trying to check his pockets.
Okay, it's all good.
I need to go get a DNA kit. I'll be right back. Okay.
No, that's perfectly fine. Perfectly fine.
Thank you.
Alright.
I'm en route
Let's,
to
untuck them from the covers here.
Yeah.
So it's a little bit easier for us, especially so the officer doesn't search me again.
Into.
Alrighty. What we're gonna do, we're gonna start from the head and work our way down. Let's see what injuries we have here. Starting from the head. Let's have a look.
Thanks.
Don't see any injuries on the head. Oh. Okay. Moving down to the neck, I did see there was a nice. There is a through and through on the eye here. Oh, there's a nice clean shot through the head here.
10-4, sir. Understood. I'll wait for you in the ICU.
I'm just trying to have a look around it to see if this was close range or if this was long range shot at all.
Yeah, Miss Watson, Peri Watson.
Okay. Moving down. So just looking at that. Okay. Suggesting from the impact wound definitely was somebody standing at a distance. Like, it's not close to the head where you would see gun residue, but it's also not far enough away at all. Okay. Alright, moving down the shoulders and arms. Medium distance. So not long distance, not close.
Tell him to open.
Burn wounds.
Dr. Watson, when you have a moment, could you open the ICU door, please?
Wounds.
I have
very
asked.
loudly. Knocks extremely loudly.
I think she's just finishing up with the.
Bangs on door. Bangs on door really loud.
I will let you in a second. I am in the middle of this bloody autopsy. Do not distract me.
Oh yeah, yes ma'am, yes ma'am.
Alrighty. Okay, I do see quite a few burn wounds here. Most likely recent, for the fact of this suit is also slightly burnt as well. Okay. Let's just see if it's across the entire torso as well. Okay. Doesn't look like there's anything on the stomach, which is just looks nice and good. Alright, going down the legs and feet. Oh, wait a minute. It looks like the middle finger is missing. Looking at the scarring on it and the healing on it as well, this definitely looks like it was from a couple days ago. Roughly maybe 3 weeks almost. Almost 2 weeks. I want to say roughly. Okay. Moving on, further down. Anything else? Let's see. Let's lift the legs up here. Double check. Okay, it looks like the legs are also slightly burnt as well. Nothing else. Okay. Does the patient on them, do you see if they have any emergency contact list at all? That, just in case. Because if I didn't have an ID, I don't think they would have any one that we'd have to call in case of emergency.
This what happens when motherfuckers become CEOs and we start acting like Vinewood and shit. We start acting Vinewood on niggas now, right? That's what we're doing.
Okay. Dr. Skip, have I missed anything at all? Okay. From my guess, I'm going to guess this was also... the head injury was most likely the gunshot wound to the head. Center of the head here was most likely the cause of death. I don't think I see anything that else that screams out to me other than the burns. I need to find out for sure where they found him and that, so I can write some more notes at all. Let's see your talk screen there. Okay. Looks clean as well. Alright. I'm gonna let officers handle the rest. I'm just gonna be standing outside, waiting. Okay, Dr. Skip? In case I think of anything else that I might have missed. Alrighty. Alrighty. Okay, let me get the other officer in here.
Oh.
Alrighty. Wait.
Oh.
Don't mind him. He's just being dramatic. Oh, yeah, I gotta go. Finley, I gotta go. Bye. All right, so you gonna take this, Rupert?
Yeah.
All right. Fingerprint him. Take the mobile fingerprint scanner as well. You gonna fingerprint him? All right. And then you gonna take the DNA sample and just I'll do the DNA sample because I gotta run it back anyway. You just gotta get him up from under the sheets.
Yeah, see if I can ease him out of the bed. Right.
Yeah.
Yeah.
Actually, give me the DNA kit. Give me the DNA kit.
There you go. That's the fingerprint, and then I'll use the DNA kit.
No. I gotta run it back to MRPD. Yep. That you're swabbing my mouth. You're swabbing my mouth.
Yep. No, I'm not. I've stopped.
Take it out of my mouth. Yep.
You get.
All right. Hold on, let me just go around the corner and get a new one.
Yeah.
Oh my gosh.
I swabbed here.
Oh, yep. Oh, there we go. Good thing I bought a spare.
Thank God for you, Mr. Wade. Honestly.
See, I gotta be prepared. Gonna be rubbing this around, getting all that DNA on me.
Sorry, mom just screaming, oi.
A little bit of blood mixed in there. That's kind of gross. All right. All right. I'll go rub. I'll go run this down to MRPD.
Alright, I'll say, did you get all the things that you needed to get off of him?
I just need to go through his pockets one more time and just and document that.
I was like, you need to remove everything from that person.
Remember, Rupert, if he had anything illegal on him, he's getting charged for it. Dead people don't have rights, but we can still charge them.
You still gonna charge the dead person?
Yep. Yeah, we are.
Jesus Christ, you're sadistic.
We need.
I wonder if he could lie on his back so I can take a photograph of his face.
I can hold him up. Oh, let me. One second. What to do? Oh, nope, they are. One second.
Yeah, you can get the picture.
Bleeding, they have got some bleeding. Okay. I know I didn't just use the right thing. It's fine.
Rupert, what was the who'd the fingerprint come back to?
Peter Blackwell.
Peter Blackwell. All right. Thank you. Uses the spare key he swiped from Perry's pocket to get out of the ICU.
What the fuck?
I'll give it back. Don't worry, Perry. Don't worry.
Oh, what? Sorry, Skip keeps on for some reason knocking him out. Let me get him on the bed. Oh my gosh. You can try taking a photo like that. able to get him. I've caused a bloody mess. I caused a bloody mess.
Yeah, I'm not really getting his angles, is it? There's a lot of blood.
It's fine.
It'll do. It looks all right. Could be better.
It's good.
But yeah.
Alrighty. Alrighty, let's untuck him from the covers again. Dr. Skip, if we can. Let's just get him untucked from the bed.
That's it. That's all I need from him. Rest in peace, my dear fellow. Look, there's less sniper rifles on the other side. If I can go when you're ready.
There is, what was I gonna say? The report is already up for you, by the way. There is an autopsy report already up for this guy.
Brilliant. Thank you so much.
I
hope he left this unlocked. Fuck.
I will let you out in a second. Alrighty. Did you get a name?
Mr. Peter Blackwell.
Peter? Peter Blackwell?
Peter Blackwell, yes.
Alrighty. Alright. So they're good to go. To cold storage?
Oh, sorry, it's Victor Blackwell. I made a
Victor.
mistake there.
Oh my gosh.
Thank God, because I was just photographing that, and it's Victor Blackwell. Let me call Wade and let him know. Wade, are you on comms?
Alrighty, I'm gonna take him to get cleaned up and everything.
It's Victor Blackwell, not Peter.
Oh my gosh, PD and I'm not understanding people's names. Oh, alrighty. Oh my god, why can't I open this door? I'm going this door. Come on. And I'll clean up all the blood in a minute. Alrighty. Nurses, if you can clean them up and then take them down to the cold storage, that will be all good for you. Thank you so much. Okay. And there's a little blood. Now we have so many reports. Okay. There you go. You are now free to go.
Thanks, Peri. You're my favorite. Appreciate you.
Well, appreciate you too.
It's been a long day, Peri. I'm very tired. I've been shot a lot of times.
And I have 5 reports on the backlog. 6 reports on the backlog.
Oh, God.
Yep. So I'm now
I
going
believe
to...
I got his name wrong for like an hour. Oops.
Oh my god.
Oh, well, it's been corrected on the paperwork.
Oh, as long as it's correct on the paperback, that should be fine. Alright. I will make sure I get that report up for you guys.
Thank you. I'm going to get moving. Bye.
Bye bye. Is EMS down here? Oh, there's no EMS down here. Shit. Okay. I'm trailing blood through the hospital. Oh my, oh my, oh my. Okay, so we have 2 autopsies, then remedy, then the others. Let me get changed. I'm probably gonna... Where can I hide? Actually, what I'm gonna do, I'm actually gonna also be in my head because I actually need to go do the garbage as well. I need to get the garbage out. Yes, I know. I'm on my way.